and cities from the first of a number of these expected settlements and judgments. So Senate Bill 275 makes several changes to the current law. One, it updates the census reference from the 2010 census to the most recent census. This way we can distribute money based on population changes without having to reopen the statute every time there's a new census. The bill also changes the appointment of one of the members, that member representing county nursing homes, to be appointed by their association instead of from the governor, because no appointment, and it's an important member. 3, we add prevention and school programs to the list of programs eligible to apply for the funding. And we also then add a school superintendent to the members of the commission. And finally, the duties of this commission are clarified to explicitly include evidence-based prevention efforts as an eligible use of the money to mitigate opioid harm. And additionally, the annual report looks to collect measures of success on the programs funded to the extent that these measures are available. Mr. James Buffetti from the Department of Justice is here. He can better answer questions about the ongoing litigation, but I'm pleased to bring you this bill. Thank you, Mr. Chair.
Thank you, Senator Rosenwald, and I recognize Representative Weber for a question.
Thank you and welcome home, Senator.
Thank you.
It's I was emailed last night an proposed amendment for this bill, and I wonder if you have been consulted about any amendments, and if so, if you have any opinion on them.
I did see an amendment a couple of days ago by email, and my plan was to bring that language to the commission. We're meeting on Monday next week, so I don't know if it's the same proposed amendment, but I've added that subject matter to our
Thank you.
agenda.
Representative Shapiro, a question, please.
Thank you, Mr. Chair. and Thank you for taking my question. I'm not sure of what the previously spoken about amendment involves, but I know that the city of Keene, where I'm from, are concerned about the allocation of funds for the municipalities that originally went in on these suits. And I guess there was another bill, I think it was House Bill 1565, that would have changed the allocation from 15% to 40%. And I'm not as knowledgeable about this as I should be talking about this. But I guess my question is there any room, as far as you're concerned, to change the allocation for the municipalities that originally went in on these suits because they have invested a lot and because they've also done a lot of thinking ahead of time of what kind of programming they would use the money for?
Thank you for the question. Mr. Buffetti is probably better suited to talk about the specifics of who's done what in litigation, but I'd say that to my way of thinking, it's not exactly correct to say these cities only get 15%. They get 15%. It's not only cities, it's 23, I think, jurisdictions. They get 15% is immediately distributed as the funds come in to the treasurer. But any program is eligible to apply for funding of the balance of the 85%. The state is keeping 0% of the money. So if you hear that the state is keeping 85%, that's really not accurate. So we are setting up rules and a process for how the commission would evaluate grant applications. But any city, any county, any program, excuse me, is able to apply for the entire 85% remaining funds.
Follow up?
Thank you. Yes, I understand that they're not limited to the 15%, but from your response, I would just guess that you're not in favor of changing that percentage of allocation.
As I said, Mr. Buffetti is better
Okay.
able to give you the history of how that was arrived at.
Thank you.
Thank you.
Further questions? Representative Gay.
Thank you, Mr. Chair. Thank you, Senator. I'm not familiar with this program at all. It's great news that we're getting some money back from the people who helped make this happen. But could you explain just in layman's terms what is the implication of the cities that actually sued first, and that from what I read, it sounded like their people were concerned they weren't going to get they weren't going to get the same kind of funds that people who didn't participate in the suit.
Mr. Buffetti will probably correct me. However, my understanding is a number of lawsuits were filed, but then they were consolidated. And perhaps after the filing, the Department of Justice really took the lead on these suits because the local litigation was consolidated. But again, he can explain that better. We are talking about tens of millions of dollars over the next 20 years. It's a lot of money.
Okay, thank you. Representative?
Thank you, Mr. Chairman. Welcome, Senator. Nice to see you.
Thank you.
Just a quick item. I'm wondering if it's a typo. On Roman numeral 6, it says on or before November 1st, 2020, the commissioner of the department shall submit an annual report. Do we mean that to be 2022?
Thank you for the question. No, this is current law, and
current law.
this is an annual report. So the first one was due then.
Okay. Thank you, Senator.
Okay, thank you very much, Senator.
Thank you.
I'd like to recognize Representative Judy Aaron, if I read the name correctly. Yes. Yeah, the N kind of faded. That's why.
Good morning, Mr. Chairman, and good morning, committee members. It's great to be here. My name, for the record, is Representative Judy Aaron. I am the representative for Sullivan County District 7, representing the towns of Ackworth, Goshen, Langdon, Leominster, and Washington in Sullivan County. And I was the prime sponsor of HB 1565, which sought to also make some changes to these opioid abatement statutes. We were looking to increase the amount of allocation of the proceeds from these litigations from 15% to 40%. We had negotiated down maybe to 30%, but I'm not seeking that kind of change today. What I'm coming to you today with, and which I emailed you last night, is a suggested amendment to this SB 275. To this particular bill presented by Senator Rosenwald, which I support, is basically some housekeeping changes. And as you hear this bill, I'd like you to consider making a few additional changes to this statute. First and foremost, I'd like you to consider eliminating what we call the population penalty, which is levied upon our counties with regard to the 23 entities which were the original litigants in these opioid lawsuits. 8 of our 10 counties are penalized now by eliminating the population of any municipality within that county that were also litigants in the original national opioid lawsuit. As a result, each county receives less money from the settlement distributions if any municipality within it joined in the litigation. The fact is that the counties and municipalities have vastly different programs which they offer and which stand to be funded by these distributions going forward. The counties should not be penalized just because a municipality within that county decided to join in the original national lawsuits. For example, Sullivan County would be penalized the population of Claremont, yet Sullivan County still serves the people of Claremont in their county programs, the county opioid abatement programs that they offer. So the population penalty isn't fair in this respect, and I have attached language which I have passed out to you, which would fix that. It would be an amendment to fix that, and that is shown on the page that says suggested amendment to SB 275. I put in that paragraph which describes the distribution according to the following formula, that the distribution shall be calculated by multiplying the settlement amount by the population factor and the allocation factor, where the population factor is derived by dividing each qualifying county's and municipalities' population by the state's total population, and the allocation factor is set at 15%. It's 15% now, so I'm not making any changes to that. And you can see on the spreadsheet that I sent out also, I used the example of the McKinsey settlement, which was the first settlement that came through. And you can see in column H what the actual distribution was. And that actual distribution included this population penalty. In column I show what the county would have received without the population penalty. In other words, if you look at Sullivan County, they would have received, instead of $9,565.87, $13,770.04, because in the column I did not take out the population of Claremont. So I think this is important. And I'd be happy to write up the amendment through OLS to do this for you. I've also, I did provide a spreadsheet that shows
Mr.
the
Chairman,
difference.
If I
Yes.
may point out, is there an extra copy of the spreadsheet so I can follow along, please?
Oh, yeah. Thank you, Representative Merchant. Sorry about that. So I've provided the spreadsheet which shows the difference in allocation distribution of the settlement dollars for this McKinsey settlement, which should have meant to the counties had the population penalty not been in effect. So again, if you compare columns H and I to see the difference, for some counties the difference is quite meaningful because the population penalty, which is shown in column G, is substantial. For instance, Stratford and Hillsborough County suffer a 49% population penalty because of the municipalities in their counties that decided to be a part of the original national litigation. And you should also know that the 13 municipalities who were original litigants represent roughly 50% of the opioid problem in our state. They recognized early on the problem, which is why they decided to join in on the national litigation. And I must add, too, that if it wasn't for these 23 entities participating in the litigation, New Hampshire may not have received anything from these lawsuits. Additionally, I have also proposed some language. Well, basically, the language that I'm proposing for this new the allocation calculation should be spelled out and clarified in statute. And finally, you brought up the point before that there was no in RSA 126A:84(6), which mentions November 1st, 2020. So what I've done is I've changed RSA 126A:84, Roman numeral 4 and Roman numeral 6, needing to be changed to reflect annual reporting and remove the 2020 year mentioned in the current statute. So with that, I'd be happy to entertain any questions about what I'm proposing. I think
Okay, we'll hold it there then, Rep. Aaron.
Sure.
I'll recognize Representative Weber.
Sure.
Thank you, Mr. Chairman, and thank you very much for taking my question. Without having been familiar with the formula before, what I am wondering is why it is that we already have the 15% that has been taken out. What your formula does, it seems to me, is double dipping on the cities, because not only does Claremont continue to get the dedicated funds for Claremont, but then Sullivan County also gets the funds that would be allocated to Claremont. So doesn't that result in a double dip?
Well, some people would suggest that that is the case, but it is not really the case, because our counties, they still include the citizens of, say, in Sullivan County, of Claremont in their programs that they do.
Right.
And so the programs that the counties are offering are way different, and different in scope and different in how they operate than what a municipality would offer. So no, they're not really double dipping, because they're doing different functions.
Follow up?
But if we're allocating the funds on the basis of population, we're counting the population of the cities twice, are we not? Under your formula?
You could suggest that that's the case, but I would counter and say that whether the municipality participated in the original lawsuit or not, there still should be funding coming to the county to help them pay for the programs that serve those people in those municipalities.
Okay, thank you. Representative Knirk.
Mine is very much along the same line, not taking the tack of looking to see if it's double dipping, but instead, since lines 8 through 10 of the original bill say the population of any political subdivision, so that would mean both the municipality and the county that receives funds shall not be included in the population of the county. So if they are getting it, all it means is they're going to keep it equal. Is that not how you read lines 8 through 10? Is that it is simply going to be the population of the county and it doesn't get counted twice?
Which lines 8 through 10 of
The original bill, the bill as amended by the Senate, not your amendment. but
Right,
lines
okay,
8
so
to
the
10.
population of any political subdivision which receives funds under this section shall not be included in the population of the county. Well, that's the population penalty I'm talking about, that they are removing the population of, for example, Claremont from Sullivan County,
Follow up.
and the county gets punished for it.
Follow up. But doesn't that only occur if Claremont is already getting the funds? I mean, this is precisely what it says, is that if Claremont gets the funds, that the county doesn't get their funds and the other funds. Isn't that what it's saying? Which is not a penalty, it's not a bonus. And I'm again referring to the bill as amended by the Senate. Thank you.
I see it as the population not being included.
Okay, Representative Weber.
And just so I'm clear about where we are procedurally, my understanding is that your original bill, which had great consideration in another committee, has been referred for interim study. Is that correct?
Yes.
Thank
But
you.
that had a change in the allocation, increasing the amount of money coming, instead of 15%, going to 30% or 40%.
But
A follow-up.
But isn't it true that that is the committee that deals with the money issues, and we are the committee that deals with the health issues? Is that not correct?
Well, it's still a matter of policy of how much money you want to, how the money is allocated.
Any further questions for the representative?
Thank you, Mr. Chair. I'm looking at the columns, and I know there's different bills we're talking about, but under column E and column F, they don't add up to the same. One's 133%, one's 100%. Why is there such a delta?
Well, because in the
Why would they both add up to 100?
because in the column E, you are not including. In column E, you are subtracting out the municipalities from. In column E, you are not including the population penalty. You have the full population of the of each county, and then you have the population of the municipalities. In column F, you would be removing, say, for instance, Claremont's population from Sullivan County, and so that's why that comes out to 100%. The other would come out to 133% because you have 33%. The 10 counties represents 100% of the population of the state.
And one more follow-up.
Thank you, Mr. Chair. So when I look at the column and so forth, what I'm hearing is the fact, back to prior comment, that there's some double dipping going on. We're counting the population twice.
You can suggest that it is counting the population twice, but it is because the county's programs are different than the municipality's programs. And the county is still providing programs for members of the municipalities that are included in that county.
Okay, Representative Gay.
Thank you, and I'll be brief. How much did Claremont, this is just an example because obviously several towns must have gotten a settlement and that's why they're being taken out of this. Where can we see how much those towns got to justify why they're being left out of this settlement?
I'm not sure I understand your question.
Well, for some reason, the towns are being penalized, so I assume that means they already got a settlement. If they did not, this makes no sense to penalize them, but it just sounds like for this double dipping concern, apparently the towns already got some kind of settlement.
Point of order, Mr. Chair. The
Representative
language-
Kinnick, point of order.
The language says clearly on line 9, receives funds under this section. It does not refer to any other funds received under any other program. We're spending a lot of time on a misreading of the bill. It says, line 9, funds under this section. So it's not talking about other funds. So we don't need to dwell on that.
All right, well, we'll stipulate that we have a difference of opinion on the interpretation of this bill, Representative Aaron. And what we want to do is to hear, as recommended by Senator Rosenwald, from Mr. Buffetti, who can give specific technical updates for us. So if we could, with your understanding, we could move on
Sure.
to that, and we know this bill would require additional work.
Thank you.
So thank you very much. I'd like to recognize Mr. Buffetti. Oh, in that case, Representative Almy, you may approach the bench. Everything's under appeal right now, so yes, you can.
Thank you. Representative Susan Elmy, Grafton 13. And I was the co-sponsor of the motion, which was interim study, which passed unanimously in our committee. We spent a great deal of time on 1365. And we went through a lot of spreadsheets. I just wanted to make clear some of the reasons that we voted to interim study this. First, we're talking about 23 entities which would get more money than anybody else in the state because they signed up for one of the lawsuits, which Mr. Buffetti will probably be talking about. Those 23 are the 10 counties, which would cover the whole state, and 13 municipalities, 12 of which are cities, one of which, the one city that didn't sign on was mine, agreeing with what the commission was doing. And those, the rest of the towns in the state include Salem and Bedford and a large number of other towns that are bigger than some of the ones in the 13 municipalities. We looked at the death data for the last 2.5 years. Couldn't get it since the second half of last year. And the deaths are occurring all over the state, in very small places, in very large places. The most of them are in Manchester and Nashua because of the populations and the population concentration probably. But that is one factor, that what we would be doing would be putting most of more of the money, originally it was over 50% of the money, in the hands of the litigants that signed on to this particular lawsuit, and less available for a statewide initiative to try to control opioid abuse in this state. And we felt the policy part of that is yours, but the money part of it was ours. And we felt that it was more important to do it from the state level. The other factor that was involved in this is that the commission has been, as you know, it takes a long time to get things through jail car, and they're going to jail car right now. Until they do, they have not made votes on discussions they have had about where the money would be first spent. And we have heard allegations that one of the first priorities would be that the money would go to the jails for jail treatment because it's extremely important in this process. It's one of the key points where that starts opioid overdose. But they haven't taken votes yet. And until then, this and we also know that there are quite a few towns that have been taking action within their towns about drug overdose, but are not among those 13 litigants. So we voted partly because interim study, because we don't know yet. We won't know until after they've taken those votes, which should be very soon after jail car finally meets on this, on whether the how the distributions would be likely to occur, and you won't know either until that happens. And then in your policy position, you could second guess something, but that would end up next year. And Uh, the and we felt that it's important. It's a lot of money, but it's a lot of money that when you divvy it up among all of those places, if you did it that way, that helps. If you do it with the population penalty, you help a little bit more places like Claremont and Manchester, but you penalize all the other towns that did not sign up for this lawsuit.
All right, Representative Almy, then your recommendation on the bill?
Well, I think I looked at it. I felt that the bill was very reasonable. I especially like the fact that they're getting the county association to appoint the county person. And but that's just my personal opinion.
So you're in favor of the bill as presented?
I'm in favor of the bill as presented.
Okay, thank you very much. I'd like to recognize Mr. James Buffetti. And if you could keep your advisories as tight as possible,
I will,
so we can learn quick.
sure, I will do my best. Thank you,
sir.
Mr. Chairman, members of the committee. My name is James Buffetti. I'm an Associate Attorney General. I have been the state's primary litigator for opioid cases since 2015. And these cases are in a variety of stages, but there is now settlement monies that are coming to the state from different settlements. We also have one trial that is scheduled for September in Merrimack County Superior Court against Johnson & Johnson. So I come in support of the bill as presented. We are in opposition to the amendment as proposed this morning by Representative Aaron. And I'm happy to talk through the issues. In terms of the amendment, and we had a vigorous debate in Ways and Means about this issue. I think I testified 5 times in front of the committee. There is a reason why the current statute counts population the way it does. Representative Aaron calls it a population penalty. It is not a population penalty. It is a protection against double counting. And so you don't get you get 15% of the funds to be distributed to those 23 subdivisions who filed lawsuits. And that's what you have, 15%. The question is, how do you distribute that money fairly? And so if you don't deduct the population from those cities in a county that filed these lawsuits, then you double count them. So for instance, in Hillsborough County, both Manchester and Nashua filed lawsuits. If you do not deduct their populations, then Hillsborough County essentially gets a windfall. And you don't get to 100%. You don't get to because there's just not enough money. There's no way that math works. It just doesn't work that way. And let me just say, we've had a lot of discussion about these 23 subdivisions. So let me explain to you as clearly as I can exactly what they did. They hired outside contingency fee counsel, right? These outside lawyers from outside of New Hampshire came in, made a pitch to them and said, we can get you a lot of money, just sign on the dotted line. These law firms filed essentially generic lawsuits in all of these counties and these 13 cities and towns. Those cases were all filed or removed to federal court. All of those federal court cases were consolidated in a court in Cleveland, a federal court called a multi-district litigation court, where those cases have stayed dormant for years. They have not litigated anything in those cases. They have not filed any motions. They have not done any depositions. They have not exchanged any discovery. They simply went there to die. And so for 23 of these subdivisions who were pitched something by these outside counsel, and for them to get 40% of the money, under that proposal in HB 1565 made no sense to us because it excludes all of those other cities and towns, those 200 or so cities and towns that didn't hire these outside lawyers. So I drafted a lengthy objection to HB 1565 that I gave to Ways and Means. I'm happy to leave a copy of that with the chair if that's of help to anyone, but it lays out exactly what the objections to HB 1565 was by the Department of Justice. I would say this, the current statute is a good statute. It's a good way of dealing with this money. It's a fair way of dealing with this money. All of the money will be used for opioid abatement, all of it. That was a first principle. And so now 85% of the money goes into this opioid abatement trust fund, a dedicated trust fund that has to be used for abatement purposes. And in a commission, which is a wide-ranging commission made up of all sorts of people, county, city, town, police, fire, we will, and I'm a member of the commission, we will consider different proposals for how best to spend the money in this state to abate the crisis so that we stop people from dying every day of opioid overdoses, which is what's happening right now. And so we should come together as a community of a state to figure out the best way to spend this money, have to have the best effect. And this should not be a fight over trying to get more money for certain subdivisions that simply hired outside counsel. And by the way, this outside counsel, it's a national firm, right? We have a case against J&J. We're going to trial against J&J. So I contacted them and said, you should move to remand your cases out of the MDL, that Cleveland court, bring it back to New Hampshire and try it. Their lawyer said to me, we don't want to do that because there's not enough money in it for them, not for the state, for them. They didn't feel it was worth their while to actually have these cases brought back for trial. So, I mean, it tells you that we're dealing with a very different dynamic here of outside counsel who, by the way, are going to make millions of dollars out of these settlements. These people are not going to be hurt. But my objective is to bring the most money we can into New Hampshire as a state, working with all of us, counties, cities, towns, figure out the best way to spend it. Now, somebody mentioned about spending the money for people who are incarcerated, right? Because one of the most effective ways of dealing with opioid addiction is through medication-assisted treatment, all right? Everybody that deals in this field will tell you that. And so the jails are spending money every day for MAT. I'm only one member of the commission, but I have said at the commission meetings, and I will say this publicly, and I will say to the commission, we should be funding MAT for every county that spends the money. We should encourage them to distribute these drugs to people in their custody who are suffering from opioid use disorder. We should support the programs that they have for people in their jail who are struggling with substance use disorder. That is a good use of our money. And so I think that we will get there, but I'm certainly going to be one voice saying this is a good use of the money, and we should make a commitment that we will take this money that comes in every year and we will use it to offset the costs that the counties currently have for MAT.
Thank you, Attorney Buffetti. Do we have questions? Representative Weber and then Representative Gay.
I have two, if I may, Mr. Chairman. The first one was simply, would you be willing to email that memo that you presented to Ways and Means to all of us as well?
Sure.
Just so that we don't have to use all that paper?
Yes. Yeah,
Thank you,
I'm happy to do that.
because some of us are drowning.
And I can just say, and I'll put it in my email, but there was at the time that I wrote the email, there were these annual reports that are submitted by the counties. We talked about it. So Sullivan County had submitted it, but I had not received it because it went over to HHS and got lost somewhere. So I just want to make sure that Sullivan County has submitted a report. And by the way, all of the reports of all these counties on a website that HHS has on their main page, and it has the opioid abatement trust fund. So you can find all those letters there that show how counties are using the money or what they've done with the money they've received so far.
Follow up,
And my second question would be, would you agree with me that the important thing to do with this money is to distribute it according to patient need rather than who filed first?
Yes.
thank you. Representative Gay.
Thank you, thank you. I'm still would like the basic numbers of money that's already going to the towns and going, because it's I hear the 30% and, well, whatever, percentages. So it would really be nice to understand how that, because to me, the simple thing would put all the money in a pot, divide it by population and need, and let's treat the whole state. I want to understand the restrictions that that apparently this 40% going to the ones who sued. Number one, how much did that cost? So that could be subtracted. That could be added back to whatever they are due. I just don't understand what money they already are getting because they participated in the suit. How
Okay.
do you balance that out with even distribution?
So I can send you, in addition to the copy of the letter, I can send you the copy of the chart that shows how much money those 23 subdivisions got in the first settlement. We had a small settlement last year, and there was approximately $414,000 that were distributed to those 23, and I can show you the amounts that were given. So, for instance, in Sullivan County,
If I may, Attorney, just send
Yep.
the information.
Okay, that's fine.
And we'll do it that way. Any further questions? Representative Merchant.
I'd like to follow up. Thank you for taking my question. Follow up on the question asked by Representative Weber. It sounds like we have, based upon population, some determination, but I think the need is probably more critical as far as the allocation. Is there any way in which the commission is looking at the need factor versus strictly the population factor?
Well, sure. I think that's going to be one of the bases for evaluating these grant applications is going to be the need. So that's one of the first things in the rules in terms of how we do it. It's going to be need based.
I'll say Representative Kinnick.
Just a quick one. You mentioned the initial settlement of $414,000, and you said you sent us information on what the 23 got. But did that go to only those 23, or did that go to the counties as well? In other words, did it go to all the political subdivisions, or was that unique to the 23?
So it went to the 10 counties and 13 cities and towns who hired outside
Okay.
contingency counsel.
Thank you.
Okay.
Thank you, Mr. Chairman.
Thank you, Attorney.
Yep.
I'd like to recognize Ms. Kate Fry from New Futures.
Good morning, members of the committee. My name is, excuse me,
Sorry.
Kate Fry. I'm the Vice President of Advocacy and New Futures. It's nice to be back in this room. I am in here to speak in support of SB 275. I will say right now, I am not taking a position on the formula, but I would like to agree what's been said about the ideal opportunity here is that we have to understand that this money will go to opiate abatement and to make up for just the dangerous situations we were in when people were with the opiate epidemic. And so I applaud that, whereas we have an alcohol fund where very little of that money goes to actually prevention, treatment, and recovery.
Ms.
But-
Fry, you indicate you have copies of written testimony?
Yeah, I do.
Is
Want
that
it
in
now?
your hand right now?
Yeah.
Yeah, if you just distribute that and just give the quick overview because we need to stay on time.
So I will be 2 minutes based on that. I'm in support of the bill, especially around the aspect of the bill that adds prevention programs for funding for the Opiate Abatement Trust Fund. We appreciate Senator Rosenwald and Representative Acton putting in this bill. Right now, if you look at the projects that can be funded under the Opiate Abatement Trust Fund, it's outlined about recovery and treatment, and we really feel the full continuum of care is necessary. When you talk about opiate abatement, the damage that was done, and what the trust fund can go to. So we are in support of the bill, but in particular the section that adds prevention to what the fund can be used for. Short and sweet.
Questions for Ms. Fry? Thank you very much.
Thank you.
I'd like to recognize Catherine, I believe it's Heck. I want to make sure I say that correctly. And you have to, as you requested, 2 minutes.
Yes, sir.
So thank you very much.
Thank you, sir. Good morning, committee members. My name is Catherine Heck. I represent the New Hampshire Municipal Association, and I did not plan to comment today as we are mostly following this legislation. However, based on testimony and the recent development of an amendment, I felt it prudent that I raise some concerns. So I won't repeat any previous testimony. I'll be brief. We're not taking a firm position on the bill, as you know, because we don't support some members over others. However, we agree that the counties have a very different function and different programs than municipalities would have. We have not seen the amendment, and we have been in contact with the 13 municipalities that originally signed into the original settlement, which are Belmont, Berlin, Claremont, Concord, Derry, Dover, Franklin, Keene, Laconia, Londonderry, Manchester, Nashua, and Rochester, and they would not like to see any change in allocation. They already have programs in place to treat, educate, and mitigate the ongoing battle with this crisis. However, communities that are not part of the original settlement, based on the 2020 legislation, might not have signed on because they also have or will be developing programs and agreed with the allocations currently in legislation. Our members are concerned about any change in formula, and they would like to see the original language stand unless a further study and input could be made possible. And that's all I have, unless you have questions, sir.
Thank you, Ms. Heck. Any questions for Ms. Heck? No, we're clear. Thank you very much. And our last person that we have signed up is Ms. Kate, is that Horgan, excuse me. New Hampshire Association of Counties, and you have a handout? Oh, good. And 2 minutes to provide the overview.
Yes, Mr. Chairman, thank you. I will be very brief. The Association of Counties does support Senate Bill 275, primarily because the nursing home administrator position was left vacant for nearly 2 years. I was informed last week that the governor finally did make an appointment to the Commission for the Nursing Home Administrator. However, we feel that the nursing homes administrators have an extremely important voice on the study commission, or on the opioid trust fund, I apologize, and that they deserve to have that position filled. So, and we had someone ready to go 2 years ago. So I will say, just on the amendment, we did support House Bill 1565, primarily because counties are the only entity that is statutorily required to pay for MAT funding, in addition to the state prison, obviously. But just to give the committee an idea on the cost, it's a little over $2 million for the 10 counties to run an MAT program. I'm happy to take any questions.
Questions for Ms. Horgan? No, we're clear. Thank you
you.
very much. Well, Chair Pearson, you may exit the building.
One gets a turn today.
Yes. Thank you. Okay, thank you very much. With no further comments, I'll call the end of the hearing relative to Senate Bill 275, and we will move now on to Senate Bill 391 and recognize Senator Rosenwald to introduce Senate Bill 391.
Thank you, Mr. Chairman. I'm Cindy Rosenwald from Senate District 13, Nashua, and Senate Bill 391 will ensure that the new secure psychiatric unit that's going to be built on the grounds of New Hampshire Hospital will be managed and operated by the Department of Health and Human Services and not be privatized. Some months ago, about probably 6 months now, Commissioner Shivenet announced publicly that for operation of the new SPU would be the case. We would be running it, operating it with oversight by the department. But this bill will place the state's responsibility for the care of individuals not guilty by reason of insanity, incompetent to stand trial, or civilly committed into statute. So this will be the legislature's policy-making opportunity. The bill does permit the department to follow the model that's currently in place at New Hampshire Hospital, which is to contract with a private entity such as Dartmouth Hitchcock for the provision of clinical services. This is what we are doing at the state hospital. It's working well, and it's what the Senate believes we should be doing with the secure psychiatric unit that we're planning. Thank you. I'd be happy to try and answer questions.
Representative Knirk.
Thank you very much. Thank you, Senator Rosenwald. That we received a letter from Neil Kirk, who had raised concerns that we'd be hiring very highly paid executives to oversee the contractor's operation. But it sounds like what you're saying is that we'd be doing the same as you already do, and that is to hire clinicians outside, and that the goal is that we would, the department would still run it and manage it, which they already do with the New Hampshire Hospital, correct?
That's correct. And just to expand on that, as you know, the state is in the process of acquiring Hampstead Hospital. And we have approved through the fiscal committee 6 administrative positions, one of which is a CEO or COO, I believe. And we have appropriated something like $165,000. You will not find a hospital, a private hospital manager for anywhere close to that amount of money. I mean, at Dartmouth, the president makes over $1 million. In Nashua, I think they make 3/4 of that. So the state does not overpay executives.
Any other questions? Representative McKay. And Representative Snow gets to turn on Representative McKay's mic.
He never can get this to work.
Well, there's a bad corner over there electronically somehow.
Am I correct, Senator, my good friend, that there really will be 2 secure psychiatric units, one under Department of Correction and one under Health and Human Services? Is that an accurate statement? There seems to be some confusion about that.
My understanding is that there will be one, but that the individuals who are currently in the secure psych unit, which is presently located in the men's prison, would be moved to the new facility when it opens. And if I'm incorrect, I'm sure I'll be corrected.
Senator from the Oversight Committee, that's what I understand too.
Oh, phew.
Representative Snow.
It was my understanding that several of the people that are in the secure psychiatric unit that's now operated at the New Hampshire prison are incarcerated patients, and that the incarcerated patients could not be moved to the new forensic hospital for security reasons, so that operation, at least for the incarcerated patients, would continue, I guess, under the Department of Corrections. And the reason for moving towards the forensic hospital was currently people who are at New Hampshire Hospital who become assaultive or commit other offenses that require greater control are now switched to the prison, even though they've never been to court. So that was one of the underlying reasons for developing the forensic hospital, so people that are not convicted of a crime do not get mixed in with the prison population. But those that have already been convicted of a prison would remain at that same unit, and it would operate as a forensic unit, and I assume it would continue to be under the Department of Corrections. Am I wrong about that?
I don't, Representative, I don't know what you've been told by the Department of Corrections.
Okay, thank you.
Point of order, Representative Weber.
Is there perhaps somebody here from the Department of Health and Human Services who could tell us exactly what the answer to that question is?
The chair accepts your second. We're doing it. And would that person please come forward?
Thank you.
Thank you.
Good morning, Chairman Pearson, members of the Health and Human Services Elderly Affairs Committee. For the record, my name is John Williams. I'm the Legislative Director for the Department of Health and Human Services, and I'm very pleased to be joined by...
Good morning. My name is Paula Mattis. I am the Director of Medical and Forensic Services for the New Hampshire Department of Corrections.
And we had this exact same question posed to us when the bill was heard in the Senate. And for purposes of just clarification to Representative McKay's and Representative Snow's question, the population currently being served at the New Hampshire State Prison includes those who arrived there by virtue of the criminal process. There was a crime committed, they were adjudicated, and they ended up there, and that's just a very short a version of it. You can hear the longer version by Ms. Mattis when I'm done with the high level. And then also the shorter version as well is that there's a population that were considered or found to be forensically dangerous and needed to be transferred from the probate court process, which is different for an involuntary admission, to the state hospital. This is a very high level summary of where things are currently. The direction that was provided by the legislature in terms of policy for developing a new secured psychiatric facility was primarily focused on the population that was coming into the process through the probate court through involuntary admissions. I am sure that Ms. Mattis may be able to further clarify, but my understanding would be that that would be the population that would be served by the new hospital that the legislature has already set forth. The bill in front of you deals with refining, allowing us the flexibility to doing the current process of hiring our clinicians from Dartmouth Hospital through a contract with them to provide those clinical services for the hospital. So that is very high level, and I hope that made sense to everybody. And if not, Ms. Mattis will certainly make much more sense than I.
I don't know about that.
Yes, Representative Weber.
Before we go on, so that we might do this quickly, I think we all know how we got here. The question was simply, after the forensic hospital is built, will the people who were incarcerated criminally continue to be treated at the prison, or will those people go over to the forensic hospital? So I don't care which one of you answers that. That's the question that I think we're trying to get at.
We will continue to provide inpatient psychiatric services for those incarcerated residents at the New Hampshire Department of Corrections.
I would
The
ask
answer is two
going
facilities.
I would ask going forward that any questions from the committee and any statements from those testifying addressed to the bill, exactly, literally. And while the other information is valuable, we are on a tight schedule.
Understood. Thank you.
Thank you. Okay, any other questions? Okay, Representative Cushman.
Thank you, Mr. Chairman.
Your question is of whom?
I was going to ask Mr. Williams, but I don't even know if he's the one that I should ask.
Okay, look at the bill. Is it about the bill?
Yes.
Okay.
So it sounds like we're hearing an example that the state would contract with Dartmouth Hitchcock. Is how is that contract going to be determined? Is that going to go out to bid? Is that okay? It's going out to bid. Do we know if it's absolutely necessary to hire administrators? I know that you said that they're not paid, or the last speaker said that they're not paid, an exorbitant amount compared to the private sector. But is it necessary to hire such administrative staff as a COO, or is it similar to like where you hire a staffing agency? They don't send a COO, they just send the clinicians. you know, the nurses, the physicians and such. Is it necessary to hire administrative staff?
The
or
bill
is it-
says the department may do this. That's what we have. That's what we're voting on. I see no further questions relating, is this related to the bill we have before us? Okay, Representative Gay.
Hi, we're all trying to speak and think quickly. The immediate question was, does this contract, does this say that we are contracting for a COO? And this just says it may contract with a private medical organization for clinical services. So that opens a door to a big interpretation. Personally, I would think you need a COO if you have a certain number of people
Not
to
germane.
administer.
They'll, we are giving them permission to run a hospital. We'll trust how they do it.
Okay.
Thank you. The chair would like to invite Representative Leon into the room. She is next door babysitting, hearing what we're doing. And before we go forward to see if there's no other questions on this, and I see none, then I will close the hearing on Senate Bill 391 and open the exec session on Senate Bill 391. Representative Weber.
I would move ought to pass.
Representative Weber moves ought to pass. Somebody from the other side, Representative Acton seconds it. Any further discussion? It was
Weber and Acton.
Weber and Acton. Representative Nutter Upham, you're in different places from where you used
Well,
to be.
this seat was available.
Well, of course it was. It was
We
your
like
seat.
her. And we're friends. Oh,
I know.
Anyway,
Okay.
having worked at New Hampshire Hospital and interned there like 25 years ago, the arrangement with Dartmouth works very well. And if this psychiatric facility is going to be built very near there, is that true?
The facility, I believe, will be attached to the hospital. Is
See,
that not correct?
And so I had heard private, well, conversations
okay.
that having the same organization, oversee hospital staff, so a doctor could do a little bit in one hospital and in the other.
Mhm.
They wouldn't have to hire a whole new set of people if this hospital had been built, 20 miles away. So I think it's a good arrangement, and I think we should pass it.
Thank you very much. Anyone else? Seeing none, and thank you so much, everybody. Would the clerk or one of them call the roll? The motion is ought to pass on Senate Bill 391, moved by Representative Weber and seconded by Representative Acton.
Representative Leon.
Yes.
Representative McMahon.
Yes.
Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt is absent. Representative DeLamus. Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro is Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
20-0.
22-0. And would Representative Weber
Representative Weber would.
donate to my campaign fund? Would you like a reconsideration?
That was a non-germane amendment, Mr. Chairman. But I would move consent.
Thank you. Concludes the exec session on Senate Bill 391, and thank you to Representative McMahon for seat filling. And were you in here?
I was listening right
You
in
were-
that
oh,
room,
yeah,
but I could hear
everybody's-
from the microphone.
Everybody's going to get a turn today, I think. Just a point about 275, which we heard a minute ago. It is due out next week. And there's no point in execing it because we've got all kinds of emails coming our way to read. It will be exec next week, just to let you know. It is an early bill. It is, I believe, the only early bill we have today, but we got a slew of them next week. Open the hearing on Senate Bill 229, an act relative to pharmacist administration of vaccines. And she's ready to go. Thank you.
I'm happy to still be here. For the record, Cindy Rosenwald from Senate District 13 in Nashua, and I'm pleased to bring you Senate Bill 229. This bill is a request of the pharmacists, and it will add certified pharmacy technicians to the list of healthcare professionals who are authorized to administer flu and COVID vaccines under the direct supervision of a licensed pharmacist. So this is allowed under the current federal emergency order. It was also authorized under Governor Sununu's emergency orders. But because the state's emergency orders have expired, the Board of Pharmacy believes our statute overrides the still existing federal emergency order. So the change to state law to allow this group of individuals to give limited vaccinations is needed. Representative Merchant, I believe, is a member of the Board of Pharmacy, if not its chair. And he probably could speak on why certain vaccines don't require higher levels of licensed or certified professionals, but this is a request of pharmacists, and the Board of Pharmacy, I believe, helped the Senate with some language changes. Thank you, Mr. Chairman.
Thank you, Senator. Any questions for the senator? Thank you so much, Senator. The chair recognizes Lindsay, is it Lamberti or? You have nice handwriting. I have poor eye seeing.
Thank you. Yes. I am Lindsay LaLiberty. I'm actually a community pharmacist serving on the Board of Pharmacy. So I did bring copies.
And if you would pass those out and you ask for 5 to 10 minutes, I'll compromise and give you 5.
Okay, sounds good. And actually, I know. All right. So as I said, I am here on the behalf of the Board of Pharmacy. We are encouraging you to vote to pass Senate Bill 229, allowing our certified technicians with proper training and oversight to administer flu vaccines in the state. Our society continues to be in the midst of a truly unprecedented time, and we have the tremendous privilege as healthcare professionals to provide access and support to our patients as they are going through some of the most vulnerable times. With the rapid expansion of clinical pharmacy services across the industry, it's ushered in a new era for certified pharmacy technicians for their roles to advance. Pursuant to the guidance under the PrEP Act, as well as the emergency order in New Hampshire, number 79, this allowed certified pharmacy technicians to administer COVID vaccines. And then with the passing of Senate Bill 155, they continued to allow that even once those orders had expired. So the New Hampshire Board of Pharmacy voted unanimously to support Senate Bill 229, allowing our certified technicians to expand to flu vaccines. The certified technician does need to be certified to start, so they do go through a national recognized program, take the exam, continue with their education, as well as becoming certified to administer vaccines, which is the same program the pharmacists go through. So let's see.
Will you take questions?
Oh, absolutely.
Any questions? Representative Cushman.
Thank you, Mr. Chairman. Thank you for taking my question. We had a similar bill last session, HB 572, that came through, and it was passed by the Senate and the House and signed by the governor. Can you just explain how this bill is different from that one, and so what changes are made between the law that was passed by that bill and what makes this one necessary, please?
Yes, I believe that is a license. Yes. So that bill allowed licensed advanced pharmacy technicians, which is a new role that is still kind of being rolled out in the state. We don't actually have any licensed advanced pharmacy technicians yet. And with that licensee class had kind of started well before COVID hit. So with COVID and just seeing how beneficial having these technicians that are certified, so they're not licensed advanced yet, certified, being able to give the COVID vaccines, it has just helped pharmacy and community pharmacy specifically tremendously. And as you know, the CDC recommends getting your COVID shot or booster along with your flu shot. So a lot of times it would cause confusion when they were in the room getting their COVID vaccine by a technician. And then all of a sudden they say, oh, no, I want my flu shot. And they go, hold on, now I need to go get the pharmacist. And all the clinical oversight is done by the pharmacist. We've checked, their consent form, their health, anything is done. And then we're basically handing over the act of administration to the certified technician. So I think especially come the fall, this will really alleviate stresses in the pharmacy.
Any other questions? Representative Nutter Upham.
Thank you for taking my question. A quick question. Who else can administer shots? LNAs are like nurses.
Yes.
I wondered who else,
So in the
with much less
pharmacy-
training than probably your pharmacists have,
Well,
was my point.
I don't know. Yeah,
Okay.
I know, just from myself being, going to a clinic, pretty much anyone, the medical assistants, the LNAs, the nurses have been giving them, as far as flu, I don't know the others.
Right.
In the pharmacy so far, we have pharmacists and interns giving them. Interns can give pretty much any of the ones that pharmacists can as well.
Okay, thank you very much.
Representative Cushman.
Thank you, Mr. Chairman. So, so we're trying to fix the fact that they couldn't administer flu shots, but they
Right.
had a narrow means of administering COVID vaccines under RSA 318:16-F, which you're repealing in line 16 of this bill. That section of law required particular conditions that would permit them to administer COVID vaccines, such as the vaccination is ordered by the supervising pharmacist. The supervising pharmacist was readily and immediately available. That the COVID vaccine was FDA authorized or FDA licensed. That the vaccine was ordered and administered according to the Advisory Committee on Immunization Practices recommendations. That the registered, there's a list of things in place to make sure that they're administered safely, that proper training is in place, and that it meets some certain standards before it can be administered. Can you speak to why you're repealing or why the sponsor and why you guys support repealing that section?
So yes, the most basic answer is so that we can include flu vaccines, because that strictly prohibits them from doing anything more than the COVID. Again, the certified technicians. And certainly if approved, the Board of Pharmacy will, formulate rules around, just as we have for pharmacists, around administering vaccinations.
Follow-up?
One follow-up.
So, I mean, without repealing the section, though, they could still administer the flu shots with just the addition in section 1 of adding certified pharmacy technicians. There's no need to repeal this section if that's the only reason. And I have some discomfort with taking it out of statute and just leaving it up to rules. And I do have another, my follow-up is, I noticed that this also takes out the requirement to report adverse events to the VAERS database that was in the original bill that was passed. So that section, go.
Mr. Chair, if I may.
Is this germane specifically to what she just asked? Because you got a
It
few ahead of you.
absolutely is.
Oh, then absolutely go for it.
Okay. If you go back and look at the RSA 318, 16B, all the things that you're referring to, Representative Cushman, are in that statute as well. So when they repealed 318F, which is redundant to 318B, we're still maintaining the same requirements in 318B that were in 318F. Yeah, and so it,
I'll take a look.
okay, take
Thank
a look
you.
if you don't. Thank you.
Yeah, thank you.
And now, with his mic on and ready to go, Representative Snow.
So I know I'm the least
Well done.
I'm in charge of a microphone, and I'm the least competent microphone operator in the entire room.
But you did well this time,
I
sir.
did.
Thank
I
you.
did well. I just want to confirm. I think she answered my question. This bill would allow the the new pharmacy technician to only do COVID and influenza, nothing else. And I'm assuming also that this technician would never be giving shots to somebody under the age of 18. Is that correct?
No,
No?
no. This would, yes, allow only flu and COVID, but it would be below to ages under 18.
It does say.
Follow up?
Yes, it does say at the end, it says, which have been approved by, to individuals 18 years of age or older as ordered by the immunizing pharmacy.
Oh, okay. Then I am sorry. I thought that had been.
Is that correct? Is that correct?
Representative Merchant.
Thank you, Mr. Chair, and thank you, Representative Snow. Basically, the way the statute is written, they are only allowed to give to the general public the flu vaccine and COVID vaccine. Any other vaccine has to be done by somebody 18 and older. The reality is this, and talking to this, is the fact that children under the age of 18 qualify for the universal immunization program, vaccine program. So when you talk to community pharmacies, they do not participate in that program. So even though the law allows them to do it, the reality is they can't because they don't get the vaccine from the state. So that's just a clarification point on that as well. So
Representative Weber. Wave off.
You understand
Any
that,
other
Nancy?
questions? Seeing none and seeing no further questions on this, thank you so much.
Thank you.
And this closes the hearing on Senate Bill 229. I know there was some questions earlier, Representative Cushman. Are you good to go? Do you want to write amendments or?
I may be interested in.
Well, we're
an
going
amendment.
to, we're going to go to an exec, so it's got to be you really do
Can't write
want.
it that fast.
Okay,
I-
so no, okay.
I do have an amendment to submit to the committee.
To this bill.
Yes.
Do you have it with you?
Yes.
Well, then we will need to open an exec session, right? I think we closed 229. If we didn't, we just did.
Mr.
And-
Chair, while he's distributing, can I clarify for Representative Snow that question? Just
You
while he's
may.
distributing.
Oh, well, actually, we're not in anything. So let's open the exec session on Senate Bill 229. Representative Knurk.
Yes, the language that's already currently in statute below is the issue about 18 and under, and that is only for the diseases listed of lines 7 through 9. The point is that the phraseology in line 5 to the general public has to do again with only the flu and the COVID-19. So the point is, it is to the general public, which could be a 15-year-old for COVID, for example, or for flu, because they do get it there. But the other ones are still for only over 18. It was what Representative Merchant said is correct, but I just want to make it a little easier that the statutory information breaks it into the two sets of immunizations. Thank you.
We do have an amendment coming around. I don't have an amendment. I have an amendment. And it is Amendment 1312H to Senate Bill 229. And Representative Merchant, if you would like to introduce your amendment.
I should be careful how I say this because it's really kind of a housekeeping.
You know,
And our history with housekeeping has not been.
the last time that led to some really good stuff.
Sure did.
So
what I have before you is the amendment, which is Amendment 2022-1312H. And why I'm amending it is if you look at the current bill, under the pharmacy intern in line 3, which goes into line 4, it refers to RSA 318B, 15B, and also licensed advanced pharmacy technician under RSA 318-15C. However, when you talk about the certified technician registered with the board, there's no reference to an RSA. So all this does is reference it back to the RSA, which is 318-15A. So we're being consistent throughout the bill, the statute, that we're anchoring everything back to an RSA.
would you like to move your amendment, please?
I would like to move.
You may ask a question. Representative Weber.
I want to be sure I understand what this is doing because it looks to me like Section 1, as inserted by Section 1 of the bill. Are you not replacing all of Section 1 of the bill by that language, and therefore you're losing a great deal of the content?
That's a good question, Representative.
I think you're going to lose a great deal of
Yes, we
content
are.
if you pass this as it is. So much for housekeeping.
Wow. Representative Knark.
I had the same question at first. I thought it replaced all of it, but since it says only the part that is the 318 16B Roman 1 as inserted by Section 1, it only takes the lines 13 through 15. So it does. Was my worry is it replaced all of Section
Okay.
1, but it says
Right.
the 318 16B Roman 1 as inserted by Section 1. So I think it's okay.
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 Agree, Ms. Representative Weber? Because you, I trust
I
you.
wouldn't have drafted it that way, but
Okay.
Representative
if
Gay.
those who know the subject area better are comfortable with it, I'll defer.
We have not a motion before the floor. We're clarifying to see whether this motion for the amendment should be put.
I
So is this a-
understand.
Okay.
I want to point out that I'm not clarified yet on the insertion of the reference to reporting to VAERS. And when you gave the explanation of duplication between F and whatever the other one is, I want to make sure before I vote on this, I want to make sure that it does include the 2 points that Representative Cushman pointed out.
If Mr. Chair, if I may.
Yes, Representative Merchant.
This is under 318-16B. If you look at the number 7, it says submit reports of any vaccine adverse reactions following vaccinations to the CDC via VAERS.
Okay, so we're retaining
Yes, you are.
retaining that.
Correct.
Okay.
And as far as looking for the issue of training and so forth, it's also, if you look at that section, we're looking for 2, 3, 4, 5, 6, and 7 remain.
Representative Cushman.
Thank you, Mr. Chairman. So there is some that's repetitive between that section that Section 2 of the bill seeks to repeal. It's RSA 318:16F, but there are some pieces of it that are not in 318B, including that the certified pharmacy technician shall complete CPR, that the supervising pharmacist shall comply with all record keeping and reporting requirements, that the supervising pharmacist shall be responsible for complying with requirements related to reporting adverse events, that they shall review the vaccine registry or other vaccination records before ordering the registered or certified pharmacy technician to administer the vaccination, that the supervising pharmacist shall comply with any applicable requirements or conditions of use as set forth in the CDC's COVID-19 vaccination provider agreement and any other federal requirements that apply to administration of the vaccine, that the vaccine is FDA authorized or licensed, that it's ordered. You know, there's a couple of things that are in 318.16F that we will lose, that were there to protect the consumers of these products, knowing that they were new and experimental. So especially the CPR and making sure that there's no duplication. I think those were important guidelines, and I would rather see, I have no issue with the bill besides Section 2 that repeals that part, really. There is still the VAERS requirement because that's in Section 1, Section Roman numeral 1 of 16B, but with Section 2 repealing these safeguards, I can't support the bill.
Representative Leon.
Thank you, Mr. Chairman. I do understand that as a newer vaccine, it may make sense to have a lot more of these. I'm curious if we would look at putting a sunset provision onto that, to not repeal it now, but repeal it 2 years out or 3 or 4 years out. If that might be a way to prevent it from needing to come before the committees again, but still allow those protections for what is a better understood, but truly still a new vaccine, so that we can keep that for now and then phase it out over time. I'm not sure if that would be something that would address that concern.
Yeah, I think that would be definitely meeting the issue in the middle. I think that, that would be appropriate after some time. I also just have concerns about these vaccines being administered to children under 18. I'm not particularly comfortable with that exception. I know that's not the content of this bill right now, but I think it's something important to think about if we're doing an amendment.
So it seems to me we are going to be preparing some amendments to this. We are in an executive session. I've not called for any motions from the floor. That's where we are in this. Representative Weber.
Well, it's up to you, Mr. Chair, as to whether we continue with the executive session or just close the executive session and let people go and get whatever amendments they want to get.
That is what I'm about to do. Thank you. And watch me do it. This closes the exec session on 2/29. It is due out the door by the end of the month. It is not an early bill, and we will kick it down the road to 2 weeks from today and take a look at the amendments. Now, I grouped all of Senator Rosenwald's bills into one great time. Senator Prentice is next week. So thank you. Open the hearing on Senate Bill 454, and the chair calls on Senator Rosenwald.
Thank you, Mr. Chairman. Cindy Rosenwald from Senate District 13 in Nashua. And I am pleased to bring before you Senate Bill 454. This is a study committee bill, and its purpose is to study the information collected by the Division of Vital Records when a woman gives birth in New Hampshire. As you know, Vital Records is part of the Secretary of State's office, and New Hampshire is the only state that does not house vital records in the Department of Health and Human Services. We did up until 2003, and in that year, it was moved to the Department of State as part of the budget trailer bill. I asked Senate research to see if they could find out the reasons for moving this division out of Health and Human Services, which 49 other states plus the District of Columbia do. They could only point to one sentence in the trailer bill that said it was to consolidate vital records with other records maintained by the state. So we really don't have any records of discussion surrounding the impact of moving these records with some extremely private information in them. At the hearing on House Bill 2, and that back then, the ACLU did mention they had some privacy concerns. I would also point out that the move from Health and Human Services to the Department of State was made before the HIPAA privacy rule was enacted, with its standards and guidelines and stiff fines for violations. So the Department of Health and Human Services is covered by HIPAA, but the Department of State is not covered by HIPAA. Every birth in New Hampshire is recorded by the Secretary of State, and they issue a birth certificate. This includes details such as when and where the birth occurred, the name of the baby, who the parents are, and this makes complete sense to be housed in the Department of State. However, much more information is collected from the hospital or birthing center and the mother, and is transmitted to the Secretary of State, although it is only used in eventually de-identified form by the Division of Public Health, which is in DHHS. Public Health regularly de-identifies protected health information for important projects, for example, tracking low birth weight babies covered by Medicaid, maternal substance abuse issues. The Department of State does not use this information, although they maintain it in totally identified form. So the information that is collected by the Secretary of State from hospitals and mothers is done on a worksheet. I am not going to hand out the worksheet because the Vital Records Division doesn't actually make it public. But it's covered in RSA 5C:19. And I'd be happy to share the worksheet privately with anyone on this committee. But out of respect for Vital Records, I'm not going to distribute this worksheet so it doesn't become part of the bill's record. Mothers are asked, however, to fill out a form which is transmitted to the Secretary of State. She is required under RSA 5C to provide her medical record number, her height, her weight, both before she got pregnant and at the time of delivery, whether she drank alcohol while she was pregnant and how much, whether she smoked before and during pregnancy and how much she smoked. She is not given the opportunity to opt out of answering these personal questions. It is required by statute, and she is warned on the form that if she lies, it is a Class B felony. In addition to this extremely personal information that we require women to tell the Secretary of State, the facility where the birth takes place is also sending confidential health information there, including the date of the woman's last period, the number of previous live births, the number of previous pregnancy losses, whether she is breastfeeding, what medical procedure she had during childbirth, her medical conditions and health risks, and whether she was using drugs. I don't know about you, but I am extremely uncomfortable with the idea of all this private medical information being held by the Secretary of State. They do not use it, and they certainly shouldn't. They state that they have strict confidentiality rules, and I'm sure that's the case, but they are not covered by HIPAA, so they are not subject to the really very stiff fines that can be levied federally and enforced by the Attorney General of the states. And as we know, breaches can and do occur even in New Hampshire. And once sensitive information is exposed, it's very hard to undo it. So I believe, and the Senate believes, we need to take a good long look at what's being collected and where it goes. There are options before us. We could move vital records back to DHHS, and then we'd be like all other states. We could split up this birth information and have the hospitals transmit the information that becomes their part of the birth certificate to the Department of State, and all of the public health and medical information could be transmitted directly to DHHS. We could leave everything the way it is and make the health information sections optional or voluntary for the mother to release. But I don't believe we should do nothing. And all of the options that I just mentioned have both pros and cons, both on policy but also cost. So I think before we should act, we should be prudent and take a look at our options over the summer and the fall. And that's why I'm before you today with the study committee. Thank you, Mr. Chair.
I heartily agree
Thank
with
you.
what you've said. However, I have a message from the Speaker's office who wants this bill killed. Not on its merits, but we've pretty much running out of people to put on study committees. And I know because I work with the Speaker's office, not just for health and human services issues, but many other issues. And believe me, it is increasingly difficult. What I've suggested to a few other people with bills, not just before this committee, but others, is someone, and usually it's the prime sponsor of the bill, could pull together an ad hoc group of people over the summer and do much the same thing. And therefore submit an LSR in the fall with the conclusions that group has come up with. So what we would wind up having next year is a bill. That is the message. I'm the messenger of it only.
Was that if I heard would you believe in your question?
That wasn't a question.
Here's what I would say about that. I did consider it, but I think any bill that makes any change suggested to how state government operates is likely to have opposition from one department or another. And if it has not had the gravitas of an official act of the legislature to compel their input, I think it is easier to argue against and kill an eventual bill. I know what I would do with this information, but I'm only one of 424 people. And as you know, sir, the Senate is always reluctant to studies, particularly in the second year. But this was a voice vote, and it was unanimous out of committee. It was a voice vote. It's a bipartisan bill, and I think it's worth acting with the gravitas of the legislature.
Senator, I anticipated your response and already delivered it to the Speaker's office. And I'm just the ping pong ball in the game. And there it is, Representative Weber.
I'm still constrained by the question. So would you believe, Representative Rosenwald, that I came in here today fully prepared to vote against this bill, but that your explanation of the privacy considerations, and I had no idea of the extent of the worksheet, because of course nobody can see the worksheet because it's apparently a private worksheet. It seems to me that the extent of the invasion of private personal information, which we have a constitutional amendment saying we're going to preserve and be very careful about, really changes my mind about what to do with this bill. And had you brought a bill to change the system, I probably would have voted for that too. But would you believe that I now am more than willing to change my vote to pass this, no matter what the speaker wants, because I think it's a really important thing to be working on.
Would you believe it's easy for the speaker to want it? I'm the one that has to go do the recruiting. Anybody else? Yes, Representative Gay.
Thank you. Would you believe the speaker might be amenable if 3 of us volunteered to contribute?
Wow, that is so
I
good.
would believe
I'll
any
volunteer.
good work that this committee does.
Gosh. Yes, Representative Weber.
Would you believe that my other suggestion was to appoint 3 senators and 1 House representative?
I have another study committee bill in a different House committee now, and the Senate already took off the second senator that I had proposed in that bill, but there are fewer of us. I mean, really, in all seriousness, I think that if our constituents really thought about this, they would be very supportive of doing a study. In my own family, I have a 7-month-old grandson who was born in Dover, and his parents are both lawyers and both have experience in the criminal system. And even they were afraid to not fill out this incredibly intrusive form because they were threatened with 7 years in prison for lying about how much my daughter-in-law weighed before she even got pregnant.
Senator, would you believe that in the Oversight Committee that I chair, not only are you present, but 2 other senators, so there is precedence for 3 senators, but well, let's just leave it with oversight. Just to humor the chair, are there other members of this committee who would be interested in being on this, making my task good? Thank you.
And I have volunteered to be
The senator. Hey, they're getting the band back together.
I'm really interested in
Yes.
this.
All right. Any other questions of the senator?
And if anyone wants to see the worksheet, I have it hidden in my file with me.
Okay, this
secret
ends the
document.
hearing on Senate Bill 454, and I'm going to step out on a limb here and exact Senate Bill 454, and the chair is looking for, I'll cross out what I had written here and put Representative Folsom moves ought to pass. Made, and who is the second? Representative Weber. Any further discussion? See, this is why we're the best committee in the House. You know, this, look at this, all comes together. Any further discussion? Nope. Okay, seeing none, the chair, when ready, may call the roll. The motion is Senate Bill 454 and ought to pass, made by Representative Folsom and seconded by Representative Weber. May call the roll.
Representative Leon.
Yes.
Representative McMahon.
Yes.
Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Yes. Representative Weber. Yes. Representative McKay. Yes. Representative Snow. Yes. Representative Knirk.
Yes.
Representative Soloway. Yes. Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes, and the question before the chair is?
Shall make a motion to put it on consent. I
Thank you.
wonder?
You don't have to make a motion. Well, you can just
Well,
suggest.
I'm new at
Any
this.
objection? Shouldn't be. Okay, consent blurb to be written by Folsom. Thank you very much.
It is a matter of some regret for me that my mother had me back in the days when she had a 2-pack habit and a 2-martini habit, and had she not, I might have actually been a contender and had a brain.
This action by your mother will be an outlier and not a model because you've turned out well. And good. That ends the exec session on Senate Bill 454. And we now have 281, and the chair recognizes Senator Gannon. Welcome to the best committee in the House. Well, I keep saying it. Keep it going. Simple, not, don't say the.
Technology is not simple for me though, but good to be here. Thank you, Representative Pearson. 281 is sort of my pet bill for the year. I shouldn't say that because that might screw it up. But I was at a nursing home a couple of years ago. My mom had broken her neck. It was a long, slow decline. She was 92, had a great life though. But so I got a call from the facility I was at, and we were looking for longer term care. All Americans said, we have a bed. There's like 17 other people want this bed. It's like the real estate world. So I went there right away, and they said, here's a 50-page contract. I'm an attorney. I should know better, but they said, you know, we'll be gone by the morning if you don't sign. So I signed. Didn't read a thing. Just get my mom in here. It's the best place in the world to put her. Nothing wrong. And it was a great facility for my mother. All American in Londonderry. Did a great job. Nothing but phenomenal things to say about the staff. Did wonderful things. So 6 months, 9 months passed. My mom passed away. Again, great life, long life, no sadness there. And I went to, it was like middle of June, and they said to me, okay, we're going to keep, you know, I emptied the room out a couple days later, and they said, we're going to keep the last 2 weeks in June and then the next full month. And I said, wow, it's about $12,000 a month, and a couple weeks, we're probably looking at $18,000. And they're like, well, you signed a thing. We have a 30 days. We start the 30 days 2 weeks after, you know, you were finishing a month, so we're not going to use June as the end month. So we were going to lose, it was 6 weeks. It was a lot of money. Most people in New Hampshire die with about $35,000 if they're lucky. So it's a significant amount of money when they take 18. You're paying for a funeral, everything that goes along with that, and taking care of the whatever. There's not much money left for most people, and so I was fortunate enough to be in a position that I could probably put more pressure than most people could, and I got a little of it back. But it was a very unfair thing. And did I sign it? Yes, I did. But they're in a very strong bargaining position when you walk in, and there's no beds available. And so should I have read every word and maybe negotiated that contract? I probably should have. But most people are certainly not even in my position that they would have the background to even read the contract. So they were going to keep 18,000. I think in the end I settled and I got like 6 back. But most people are not. They're going, so it's a 30 days, and it was, they also were enforcing me 2 extra weeks. So I thought this was very unfair, and I did not want other people following after me. My parents are gone, but I'm getting up there in age. My kids will deal with it. Your kids will deal with it. We all, every single family in New Hampshire is dealing with this, and in by the thousands and thousands every year. So right now it's at 30 days. And again, I was in a situation where they tried to tack on 2 additional weeks. Whether or not they had a right to do that, that's one thing. So I looked at the law. The law says 30 days from date of death. And I don't like taxing dead people, especially because there's no wait at these facilities. It isn't like they're going to have a 30-day period. They can't do it. You leave, you take your few possessions, and they're very meager at most of these nursing homes at the very end or facilities. And so from the date that you take the last piece of furniture out they have 10 days. And they probably can find someone in 2 or 3 days, paint the room, put a new carpet in, and that's about it. So none of the facilities are complaining that the 10-day period is a burden on them or anything.
Okay.
It's a very fair time period in case maybe they don't have someone to move right in. Maybe somebody really damaged the room and just wall damage. I can understand that. You got time to fix the room. So we're giving them time, a 10-day period, which all the nursing homes seem to agree is a fair period of time. So we're cutting back, most nursing homes will say they're in the vicinity of $12,000 a month. So if you go from 30 days down to 10, you're giving every family in New Hampshire who has to deal with this $8,000 more to deal with their family affairs.
We got to move along. Will you take questions?
I will. So this seemed very good. My only one thing, there is a very good lobbyist who's going to testify after me with an amendment to move it from 10 to 15, because in New England, their nursing home groups tend to have a 15-day period. New Hampshire's New Hampshire. If it's a little more paperwork for the nursing homes to make it 10 days, it's a $2,000 difference.
Are you okay with this amendment? As
I
it
am
comes?
not, because it's going to take $2,000 out of every New Hampshire family that has to deal with a death. So
Okay.
I would rather it stay 10 days. Is 15 better than 30? Sure it is. But when I have a bill that everyone thinks is good at 10 days, I know it may be in the financial interest of the nursing homes to keep another $2,000 of your money. I don't think it's fair. I will take
Thank
any
you.
questions.
Representative Gay.
After having dealt with this with two parents, I would like to be more specific in the date, how much you owe or how many days you're charged for, because it says, I love this bill. I just want to clarify
Sure.
that with the day of death, to me, 10 days after that ought to be enough. 10 days after you empty the room, which can be that day. This is kind of just says the month in which the resident dies shall be considered the last month of residency. That sounds like you would have to pay for that entire month. Is there any way to say you pay prorated up to 10 days after you clear the room?
The attorneys who have looked at this told me that it means 10 days. So the 10 days would be, but it would be after. So if you left a ton of furniture and the nurse, you really occupied that room and you painted murals and and it takes them, we're giving them time to clear it up. But it would be, so if you died on a Monday, your family had the stuff cleared out on Thursday, it would be 10 days tolling from that Thursday when you had your furniture gone.
Could we spell that out? Because right now it just says you're obligated for the last month. There's nothing about prorating. It almost sounds like you could stretch it and say, oh, you pay to the whole month and then you have to pay for another 10
Line
days.
7 to
Make it a
9.
question. Thank you. Representative Knurk.
Yes, just a kind of quick question. When this, on line 4, it says, for which residents are paying out of pocket. And I was curious why this would not also apply to residents covered by their Medicaid or insurance. Are they covered by different statutes?
I don't think it's different statutes. I was only concerned with your personal money. I wasn't really concerned with the government, Medicaid, Medicare. So I could see where that could apply, though. And as to your question, Representative Gay, I think I don't have a numbered script in front of me. I don't have lines on my thing, but where it says the month in which the nursing home assisted facility shall be entitled to rent and fees for not more than 10 days from the date of the resident's death, provided that the room's clear. I think that makes it clear that you get the date of death and then however much time to clear. I don't think it needs to be more specific, but if this committee does, I'd entertain whatever you thought made it more clear.
Representative Folsom.
That's Gannon. Okay. Thank you.
In response a bit, thank you for taking my question. Senator, where it says or other responsible party at the end, does that help include the Medicaid, Medicare? No. Okay. Just wanted to.
I don't think so.
That's just the material.
Anybody else with a question for the senator? Seeing none. Thank you. And
Very good.
Chair recognizes Brendan Williams from the New Hampshire Healthcare Association.
Thank you
Come
for your time.
on up. Yes, thank you for your bill.
Thank you, Mr. Chairman, honorable members of the committee. For the record, I'm Brendan Williams. I'm the president of the New Hampshire Healthcare Association. I'm not the very good lobbyist that Senator Gannon referenced. However, I do think that this is a very good bill. We are seeking a change. We think that the bill was improved in the Senate to provide for the 10-day period. We would seek to make that a 15-day period. And let me back up and just say that we represent various types of facilities. We represent most of the state's private nursing homes, with a few exceptions: a county nursing home, a pediatric care facility, continuing care retirement communities, and also assisted living facilities. The idea of not charging beyond a resident's death is the norm in nursing homes. That wouldn't change the status quo. Even the 10-day period really wouldn't be necessary for nursing homes. With respect to assisted living is more analogous to living in a residential setting, clearly by its definition, more analogous to living in, say, an apartment. The idea that you could somehow turn an assisted living residence in just a couple of days just simply isn't the case, particularly now at a time of an acute staffing shortfall throughout our long-term care system. Prior to the pandemic, there were over 400,000 more employees working for nursing homes and assisted living facilities in our country than there are today. And so staffing has become very, very challenging. And facilities, assisted living facilities, are budgeting in advance when they have a resident in order to meet that resident's needs. And because the setting of an assisted living facility is more residential, it's not analogous to, say, a hospital room, which a nursing home room might be deemed analogous to. It is something more than that. So we think making it 15 days would be similar to what Connecticut does. Connecticut is the only other New England state with this type of good consumer protection. And we would just simply respectfully suggest that we not go any further than Connecticut in establishing this sort of consumer protection, because we do have providers that do business in other states. Finally, I would say that there was a question about the second sentence, the month in which the resident passes shall be considered. I would respectfully suggest that that sentence just simply be struck, because I think it creates a bit of ambiguity, and I think that the rest of the language in the bill is clear on its face. And with that, I would happily take any questions.
Yes, sir, thank you for coming. And have you contacted any member of this committee to prepare an amendment such as you advocate?
I know that our lobbyist has shared an email with you, Mr. Chairman, with respect to the language of the amendment, and has spoken to the co-sponsors of the legislation regarding the idea of an amendment. We know that Senator Gannon has a difference of opinion, which I certainly respect. With your leave, Mr. Chairman, I think Representative Gay has a question. Oh, yes, Representative Gay, the sentence that begins on line 5 and goes to line 6, beginning the month, I think that that should be stricken, because I don't think it adds anything to the bill, and it seems to create a little bit of ambiguity. I think the bill itself is very clear on its face in terms of what it's trying to accomplish without that sentence.
Representative Merchant.
Thank you, Mr. Chair, and thank you for taking my question. What's the vacancy rate right now for a nursing home or assisted living facility in New Hampshire?
Well, the vacancy rate in nursing homes is pretty appalling. I think that we're probably at and I'd have to look at the latest data reported to the federal government, we're probably at a 75% occupancy rate in nursing homes. Prior to the pandemic, we were in excess of 85% probably. And so we were actually pretty full prior to the pandemic. Right now, the problem in nursing homes is not a lack of people willing to move into the facilities. It's a lack of staff to take in admissions. And so the state, as you're aware, has entered into contracts with some nursing homes in order to provide extra staffing in order to relieve that pressure upon the hospitals. But that's an admirable endeavor on the part of the state, but it's a piecemeal approach. Facilities really just can't admit now in many cases.
The other part of the question was assisted living facilities.
I think assisted living facilities are in better shape for the most part. Assisted living facilities, and this kind of gets to a question too that was asked, typically in our state do not take Medicaid. Medicare does not pay for assisted living care, hardly pays for nursing home care. And so I think assisted living facilities are doing better. However, again, if you look at the national data where, over 400,000 fewer workers now are serving residential care and nursing homes, the federal government lumps those two things together. I would say probably 3/5 of the loss is in nursing homes, but 2/5 would be in assisted living facilities. So everyone's seen the consequences of the pandemic when it comes to their staffing.
Representative Knirk.
Thank you very much for taking my question. Whether we stuck with either 10 days or to 15 days, either one, can you see any reason why this should not apply to all payers and not just to those who are paying out of pocket?
I really don't see any reason for that beyond whatever complexities might exist in statute or at the federal government level with respect to Medicaid and Medicare payment. And my sense, Representative Knirk, and I can answer this definitively for you, is that that's probably already taken care of. I don't think that the state is paying for empty beds through its Medicaid rate. If anybody here from the department is here, they could correct me on that, but I wouldn't think so.
Representative Weber.
I had essentially the same question as Representative Knirk, only coming from the other direction. I was going to ask you how long Medicaid pays after somebody dies.
I just don't think it probably pays at all after they die. Medicare, I think people have a misapprehension in the general public that it pays for nursing home care. It does after a qualifying 3-day hospital stay in full for 20 days, in part for 80 days. So while it's a significant source of revenue for nursing homes that are engaged in rehabilitation, it doesn't apply at all when it comes to assisted living facilities.
Any further questions for Mr. Williams? Seeing none, thank you so much.
Thank you, Mr. Chairman.
And the chair calls Alex Kutrubis. Did I get the name right? It was your phonetic spelling that helped.
I did. I wanted to help you out.
I appreciate that. And if you have written testimony, could you start it around?
I do not, but I can email it to you if that is acceptable.
It is acceptable.
So thank you, Mr. Chair and members of the committee. My name is Alex Kutrubis. I'm here representing the New Hampshire Association of Residential Care Homes. We are in support of the bill. Just to give you a little quick history, we did have some concerns with the bill as introduced. However, in working with the sponsor in the Senate, we were able to amend it into something that we can support. The issue that we had with the bill was clarifying that personal property and articles need to be removed from the unit before rental fees would end. And that issue has been clarified. If you look at the bill as amended by the Senate in lines 8 through 10, we feel that that adequately addresses the issue. In most cases, this is not a concern, and the family or the responsible party does clear the unit very quickly. You heard Senator Gannon had the unit empty 2 days after the passing of his mom. So it's generally not an issue, but occasionally there is an uncooperative situation, and we're happy that this language was included in the Senate version. So again, we do support the bill, and the Senate amendment takes care of our concerns. I wasn't prepared to speak to Brendan Williams's amendment. However, we certainly would support moving it from 10 to 15 days. And I do agree with him. I've read this bill many, many times, and the sentence, the month which the resident dies shall be considered for the purposes of rent and fees the last month of residency. That sentence has always confused me in this bill too. So I definitely think if you remove it, it would it would eliminate any ambiguity or confusion, because I think it's inconsistent potentially with the remainder of the bill. I haven't, again, we did support it in full disclosure. We did support it with the 10 days in the Senate. However, 15 days, if Connecticut's doing that, we certainly would not oppose that. And I think Mr. Williams made some excellent points of why we should potentially consider moving it to 15 days. So with that, Mr. Chairman, I'll
Would you
end.
take any questions?
Of course.
Any questions? Okay, thank you so much.
You're welcome. Thank you.
I am not in a position to put this amendment in, given my horrific schedule. Both of my day jobs are on maximum the next 2 weeks. If there is anybody in this committee who is interested enough in doing that, Representative Weber?
Mr. Chairman, I would be delighted to get an amendment that removes the troublesome sentence on lines 5 and 6. I'm not willing to change the number of days. So if somebody is concerned about the number of days, then they need to do it. But otherwise, I'd be glad to get one that just removes that sentence.
Is there anybody here who is likely to present an amendment to move the number of days? I don't see any. Representative Knark?
No, but I would want to bring up whether Representative Weber would be willing to take as a friendly addition just changing it to all payers. But we have to check
No,
with DHHS.
I would
first.
not.
Okay.
Because I'm pretty sure that it's not needed and it's going to cause enormous confusion.
Got it.
So it looks like the amendment that is being prepared will take out that bad sentence, but will not change the number of days from the Senate. So with that, I close the hearing on Senate Bill 281, and we will bump this down the road 2 weeks to the 5 and 14, the 19th. And the amendment will come in at that point. Opening the hearing on Senate Bill 414 FN A relative to the definition of Alzheimer's disease and related disorders. I was privileged to sit in on a 1-hour Zoom session on March 29th and also a person-to-person meeting with the speaker and majority leader and numbers of people who work to care for folks with Alzheimer's the next day. So I've done my homework, and who is going to present this bill? Who is Am? Oh, you Am, okay. Representative Knark?
For the record, Jerry Knirk, Carol 3, and I'm introducing this on behalf of Senator Kevin Avard. I also was in on the phone call conference that we talked about, and since I prepared this for that, I just volunteered to him that I would do this so that he would not need to be coming over, and it turns out he has a conflict. So what SB 414, and I've passed along testimony, everybody should have it by now, it broadens the definition of Alzheimer's disease and related disorders, or ADRD, in RSA 161F66 to include individuals who demonstrate ADRD to an extent that their symptoms interfere with activities of daily living, even if that formal diagnosis has yet been made. The meeting this definition is necessary to be eligible for respite services under 166F67. The related disorders are things like vascular disease, Lewy body dementia frontotemporal, and Parkinson's. The point is that the respite program is in place to support family caregivers. Therefore, that supports care in a less costly home setting rather than being institutionalized. But family caregivers really suffer greatly because of the time commitment when they're taking care of their loved one at home that leads to their own difficulties with mental health and physical health. We sort of need to provide or support these caregivers before they burn out, not wait until after they've already burned out and put their loved one into a nursing home. So the expansion of this definition is important to be able to capture those individuals that have become so symptomatic they need a lot of care, but they've not yet received the formal diagnosis, or when individuals have significant symptoms, but they're afraid to go to the provider because they fear the diagnosis or because of things like lack of access. There's often a delay of about 2 to 3 years between the onset of symptoms and the time of diagnosis. Clinical diagnosis is easy when you have a simple test that you can do that says yes or no. but it's really a lot harder when you have a spectrum of disease presentation, and also when the early symptoms can be really subtle. Like, who of us in here has not had a time we've been a wee bit forgetful and kind of wondered whether we're going down that road too? Never happens. Oh, you're right. Now, so the definitive diagnosis of Alzheimer's and other related diseases is done at autopsy. That's when you examine the brain and you say, yep, that's for sure what it was. But the clinical diagnoses can be fairly accurate if carefully done. But carefully done is a key word. It takes time. The clinical diagnosis, you have to do a careful history of the patient and the family, and have to take into account that the patient's history often is colored a bit by some of the coping mechanisms that the family and the provide. Oh, yeah,
Hi.
okay. I got you covered.
Welcome.
Okay.
Come back when you can stay longer. Okay. I am too, Senator.
All right. So, for those who don't know, that was Senator Avard. Anyway, so the coping mechanism may hide it. Also, you need to do some cognitive and mental status screening tests. Sometimes you have to do advanced imaging, like an MRI, to rule out tumors, vascular disease, and sometimes neuropsychiatric testing. So, as with any diagnosis, some providers will have a fairly low threshold for making a diagnosis. Others may have a high threshold and require advanced testing before they're even going to make the actual diagnosis. But other barriers that come in: stigma of the diagnosis on the part of both the patient and the provider. The provider may be hesitant to make the diagnosis. They may be concerned about the diagnosis being distressing to the patient or to the family. And the patient or family may be in denial. Again, that moment of forgetfulness. How many of us go, oh my God, I hope it's not Alzheimer's. So there are other systemic things as well, like the provider not having enough time to really go into this in detail when they have other medical problems that need attention in that short time. And it can often be very difficult for the family to discuss mom's, problems right in front of her. So there's also, last as always, for those of us, particularly in rural areas, lack of problems or lack of access due to lack of specialist access. And there's always the usual cost barriers to obtaining care. So what this does, it improves the respite program by increasing the eligibility to capture the caregivers before they burn out and end up having to put somebody into a nursing home. That's really what it's all about.
Any questions for the representative?
Representative DeLemus.
Representative DeLemus.
Thank you, Mr. Chairman. I'll try to be very brief. I went through this. I cared for my mother at home, and it was a very long process, 7 years.
Make sure it goes to a question real soon.
So who makes the determination when there's no clinical diagnosis? I mean, could I have said, oh, my mom's got dementia, so therefore I qualify for whatever program?
I actually had that exact same question, and I posed that when I was asked to be a sponsor. I think the Alzheimer's Association may be able to tell us a bit more about it, or somebody from the department who does the rest. But as I understand, the caregiver's self-report, if the medical provider has said that the person has qualifies as having had that diagnosis, but they do not have a form for the medical provider to fill out. That is my understanding. We can get clarification from them.
Representative Weber.
And isn't the point of the change in the disease that we are linking the entitlement to care not to an actual diagnosis, but to a condition in which the symptoms interfere with the activities of daily living, so you don't have to have a diagnosis? The qualifier is that there's a substantial impairment of the activities of daily living so that more people would qualify.
Yes, exactly. I mean, that's because the point is they may not carry that, gold card diagnosis as I have Alzheimer's, but they are so disabled that they need it because of the activities of daily living. That's really what this bill does. It expands the definition.
Representative Knurk, did I share with you earlier when we discussed this that my father had Parkinsonian Dementia?
Yes.
Which is not Alzheimer's disease.
Right.
But wow, the symptoms sure are running parallel with it.
That's the related disorders. That's why it's Alzheimer's disease and related disorders, because there are a number of other related disorders that are in that. Like, as I said, it's a spectrum. It's a broad diagnosis. And in this case, it's a little easier. If you have Parkinson's, you develop it, it's probably likely to be the Parkinson's dementia. But in terms of parsing that out. It's the impact on your life that matters. It's not the exact diagnosis that matters.
Representative DeLamus.
Sorry to beat this one. So is it the caregiver? I mean, I noticed that my mother was declining and she was definitely, it was a problem. So would it have been myself saying, hey, she's not doing well now? She's got, I think from what I've read, she's got dementia. Who gets to say that you've got a decline if it doesn't need a diagnosis?
As best I understand, if you were, this is again, it's only having to do with this respite program. It has nothing to do with anything else. That if you were going to apply for it, you would self-attest. They may have some questions about what the impact does on activities of daily living. If all they require is some very minimal supervision of finance, they probably say that doesn't really count. But if you're 24/7 caring for them, that's going to count clearly.
Do you wish a follow-up? Welcome.
Thank you. So it would have been myself or i.e. the caregiver who would be the one to determine.
Well, they would be the one to apply. As far again, I will defer to either the Alzheimer's Association behind me may know the exact answer, but likewise, if there's anybody here from the department that does that program, they'll be able to tell you once it's applied for, how do they do the verification? I do not know that part. Thank you.
I suggest that we call upon them. Thank you
Yes.
so much for
Thank you.
making your presentation, because the people coming up next will probably better answer the questions that have not yet been asked. Call Mackenzie Nicholson from the Alzheimer's Association. Good to see you again, Mackenzie. And you've got things to hand out, do you? If you would take your mask off so we may hear you, please. They've been handed out.
How are we doing?
You're
Okay.
doing great.
Thank you.
Welcome.
Thank you, Chairman Pearson and members of the committee. My name is Mackenzie Nicholson. I'm the Public Policy Manager for the Alzheimer's Association Mass New Hampshire chapter, and I'm before you today asking for your support for Senate Bill 414, an act relative to respite care services for persons caring with individuals with Alzheimer's and related disorders, and making an appropriation therefore. And before I begin my testimony, I just wanted to mention that Wendy Altman from the department is here this afternoon and can speak better than I will be able to about the process that someone will go through to receive a respite grant for your question. In New Hampshire, there are an estimated 26,000 individuals living with Alzheimer's or dementia, and another 58,000 or so Granite Staters providing care to those folks. Caregiving of those living with Alzheimer's and dementia can be incredible. You're muting me, sir. Apologies. So caregiving of those living with Alzheimer's and dementia, they have incredibly difficult jobs, and they often assist their loved ones with one or more activities of daily living, including bathing, dressing, eating, things like that, and as well as multiple instrumental activities of daily living, such as paying bills, shopping, transportation, that kind of thing. 83% of the help provided to older adults in the United States came from family members in the past year, friends, or other unpaid caregivers. And in New Hampshire, more than 82 million hours of unpaid care to loved ones experiencing Alzheimer's or dementia alone happened in 2020 at an estimated economic value of $1.4 billion. In order to provide the care for this loved one, many caregivers report needing to cut back hours, take a leave of absence, or leave the workforce entirely. They also experience depleted income and finances due to paying for the health care or services that their loved one needs. The lifetime cost of caring for someone with dementia was estimated at over $370,000 in 2020. 70% of that lifetime cost is borne by family caregivers in the forms of this unpaid caregiving and out-of-pocket expenses for items ranging from medications to food for the person with dementia. In addition to the economic burden placed on these caregivers, as the person with dementia's symptoms worsen, caregivers often experience their own increased emotional stress, depression, and newer exacerbated health problems. 74% of caregivers of people with Alzheimer's or dementia reported that they were somewhat concerned to very concerned about maintaining their own health since becoming a caregiver. Evidence also suggests that providing dementia care can increase their susceptibility to a multitude of diseases and health complications.
Yes, thank you.
Thank you.
Don't look at your text and just summarize your points, please.
Sure. So I think that Representative Knirk summed up very well why medical providers may be hesitant to make a diagnosis. So I won't pull that out for you. But we know that starting respite as soon as possible is beneficial because it helps reduce that burden off of those caregivers. The sooner the better, obviously. And so the reason that we're changing the definition of Alzheimer's to include folks who are symptomatic, to expand this population and get folks who are earlier on in the disease process is why we're doing this. Last thing I'll say, which is separate from sort of the facts and figures about this, is just a little personal story, is that this is personal for me. My mom experiences some sort of Alzheimer's or dementia. We don't know what it is. My father, who is her primary caregiver, takes care of her. He, for one reason or another, he doesn't push her to explore a diagnosis. He doesn't push her doctors. Very admirable, but to that same front, he needs help. He's in over her, his head with her care, and I believe, having access to a respite grant could gratefully help him. Not only him, but the 26,000 plus or more individuals who are living in the Granite State with Alzheimer's or dementia. So, with that, I'm happy to take any questions.
Any questions? Representative Merchant.
Thank you, Mr. Chair, and thank you for taking my question. If we expand the program, which I think makes sense, I saw a note in here that it could possibly cause a problem with current recipients because there's not enough money in the budget to accommodate that. So are we placing people at jeopardy who currently have receiving respite care through the state funds, that we don't have enough to take care of everyone who may be reclassified?
Thank you for your question, Representative Merchant. I believe that the department has everything that they need to expand the program right now, including an increase in the grant amount thanks to American Rescue Plan Act funds. But when Wendy Altman is here from the department, she may be able to better answer that question for you.
Representative Kofold.
Thank you, Mr. Chairman, and thank you for taking my question. I'm curious about the inclusion of the word irreversible. And I've just been through this with my father, so I'm aware that there's not necessarily an optimistic situation, but I guess there's a part of me that wants to be optimistic about the long term. Dr. Dale Bredesen and others, I think, have explored, have some successes there. So my question is the inclusion of the word irreversible, is it necessary in your opinion? Would it potentially put some people at risk of not qualifying as advances are made, and perhaps there is some new hope for people with Alzheimer's?
Thank you for the question, and I appreciate your optimism. I don't have the bill text in front of me, so I can't speak to that line, but I will say that Alzheimer's and dementia are ultimately fatal diseases as of right now. And I look forward to those advances in science where one day we might not get to a place where things are reversible, but as it stands right now, Alzheimer's and dementia are irreversible and fatal diseases.
Let me ask you a question that follows up on his question. If for some reason my dad came out of his Parkinsonian dementia, he wouldn't need the extra care that he did need when he had it. So it becomes a moot point. That was a question.
I would believe it.
Yeah, thank you. Any other questions, Representative Weber?
Would you believe that as I read the bill, the word irreversible only applies when there isn't actually an Alzheimer's diagnosis? It's the other conditions that it applies to. So it might eliminate, for example, a traumatic brain injury for which recovery was expected, but it doesn't apply if there's actually an Alzheimer's diagnosis.
I would believe it.
Any other questions? Thank you so much. Good to see you again. And Wendy Altman. And I need to know, what is the SOPS campus? Are you in college?
No, sir, I am not.
Okay, then the follow-up is, what is SOPS?
It's the State Office Park South Campus for DHHS.
Oh, yeah, some of you didn't,
Yes.
some of you knew that probably. Thank you.
Thank you. Good afternoon, Mr. Chair. My name is Wendy Altman, for the record. I am the Bureau Chief at the Bureau of Elderly and Adult Services here at New Hampshire DHHS. And I'm here in support of the bill. And I just wanted to make a few points and have made some notes about some of the questions that have been asked. And if you would like me to address those, I will.
Yeah, repeat your title, please.
I'm
Your
sorry?
Bureau Chief for...
The Bureau Chief for the Bureau of Elderly and Adult Services.
Thank you.
At New Hampshire.
You're going in my phone, so I just want to get it right. Thank you.
And I have hearing aids actually, so it's,
So do
it's
I.
almost ringing in my ear with the microphone, but that's okay. I can hear, that's good. So we support the definition, the expansion of the definition. This is twofold. We experience and observe the need for individuals to have access to supports and access to information prior to a diagnosis. And we also know that many people hesitate to see a physician or a doctor to receive that diagnosis. We do have resources that have been earmarked to support additional dollars that would go to respite grants, as well as to address expansion of the definition if that results in additional people being eligible for the program. We currently have Older Americans Act, ARPA funding that will go to support family caregivers. And this will be allocated to our respite grants, including our ADRD respite services.
Does that conclude your testimony?
That concludes my testimony, and I'd like to be able to answer any questions.
Representative Weber.
As a follow-up to Representative DeLemus's question earlier, could you just explain what happens when when a caregiver applies, how the department makes a determination of whether a grant is given?
Sure. Currently, our family caregiver and ADRD respite grants are administered and operationalized through our Service Link Aging and Disability Resource Center programs around the state. We have family caregiver specialists who perform options counseling as well as information and education. They provide that directly to the caregivers who are supporting individuals who present with characteristics or have been diagnosed and are looking to receive respite grants. And oftentimes we will work with those family caregivers and that individual, and we will go to see them in person and provide an assessment looking at what characteristics are they showing, what kinds of needs do they have. Most often it's presenting with the need for assistance with activities of daily living and safety.
Representative DeLemus.
Thank you, Mr. Chairman. Thank you for taking my question. So in just an anecdotal thing, I did not know that there was this kind of a program at all for my mother who was suffering. So if you don't go to see a doctor to get a diagnosis, but you have a loved one that you're caring for, how do you know where to go for this help?
Oftentimes, when we are monitoring and looking at where referrals are coming from, they're coming from doctors' offices, places where individuals may have been seeking or accessing other supports and services, such as senior centers, adult day programs, the Alzheimer's Association, and other groups that may be helping either the family caregiver or the individual who may be presenting with some of those characteristics.
Representative McMahon.
Thank you, Mr. Chairman, and good morning, Madam Altman. Specific to rates of pay, and this is something we've worked on in the past together, matter of fact, is within this bill, is there a opportunity for an increased rate of pay for direct service providers to be present and take these jobs to take care of folks in their homes?
So the way the program is operationalized is through an actual respite grant. We contract with a fiscal management entity who would help with paying for that support or service. For example, an individual may need respite for a week to be able to go away. We would pay for respite at a facility or assisted living, or pay somebody to come to the home to provide that care. Sometimes it's respite so the caregiver can go grocery shopping or run errands and do those kinds of things. And it can be the neighbor or a family member, or they can solicit and hire somebody, and they would choose and direct how that care would be paid for with the amount of money that we're able to give in the grant.
Follow up.
Thank you, Mr. Chairman. Then to be clear, there's not, as has been in the past, an arbitrary cap to what an hourly rate would be to provide this service under that construct.
Correct. There's no guardrails in terms of caps on rates of pay or what we will pay for in terms of respite. It is something that's discussed with the family caregiver service link and the exploration of which care providers they want, whether that's enrolled licensed providers to provide certain care, or asking somebody to come into the home.
Thank you, Ms. Altman. Thank you, Mr. Chairman.
Any further questions, Representative Merchant?
Thank you, Mr. Chair, and taking my question. I'm looking back on the methodology on page 3, and if you look down, it talks about in fiscal 2021, there was $327,000 appropriated for this program. It was reduced to $302,508 in fiscal 22-23 biennium. Again, my concern is that I think the policy is a good policy, but I hate to look at the policy and saying we don't have the ability to either support it or jeopardizing those who currently use the program, because I think we need to protect the ones that are currently in the program and not have them subject to a harsh reality because there's not enough funds to support the expansion of the program. Would you believe?
A question.
Thank you. I'm sorry, this is blocking my view, so I'll try to. So the budget that we have in biennium 22-23 was based off of utilization in state fiscal year 20. What we are doing is monitoring the need and looking to formulate any justification for an increase in the next biennium in terms of a request for funds to support individuals through this respite grant, which we would do through the normal budgeting process. So we're monitoring for the need and will ensure providing justification for that if there's more funding needed.
Representative Weber.
So let me just ask about the ARPA funds you were talking about. This was funds that was already budgeted. The 300 and am I right in thinking that, first of all, the 327,000, that's already budgeted? And are there ARPA funds in addition to that that are available for payment going forward? I mean, for a short time anyway.
Yes, ma'am. Yes, Representative, the budgeted amount, which is the 327, is something that's general funds.
Right.
It's in our budget. The ARPA funds are in addition to that.
Right.
And the time frame for those older Americans ARPA funds go through September 30th, 2023. So it brings us, it crosses over or overlaps into the next biennium.
So a follow-up, Mr.
Follow
Chairman?
up.
So what I'm understanding you to say is that expanding the program is not going to be a problem right now. It's not going to result in any loss of services to those already on the program, but subsequent to 2023, we would need a new budget allocation based on our experience going forward. Is that correct?
Yes, we would be prepared to request additional funds for this budget for the ADRD funds if the need is demonstrated and we have justification for that request.
Seeing no further questions, thank you so much. And with this, I will close the hearing on Senate Bill 414, and like to open the exec session on the same Bill 414. And I would like to call on, the chair would like to call on Representative Knirk for a motion.
Yes, I would move OTP.
And I would like to second that. Any discussion? Ready to go? Would the clerk please call the roll on Senate Bill 414-FN-A? The motion is ought to pass. Moved by Representative Knirk and seconded by the chair.
Representative Leon.
Yes.
Representative McMahon.
Yes.
Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway.
Yes.
Representative Cannon. Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21-0 passes.
I suggest it goes on consent. And also ask. It's going to suggest you buy lunch, but never mind. Okay. Ends the exec session on Senate Bill 414. I have a few announcements here at lunchtime. Number one, you probably have seen next week's schedule has been changed because we got late from the Senate some early bills that have to be done next week, and they don't look easy, some of them. Secondly, therefore, we will meet on the 12th. We will meet on the 19th, the next 2 Tuesdays after this. And thirdly, she snuck out. I almost got her. Were there side-by-side handouts available on the table over there? Okay, well, I'll talk with her over the lunch hour and we'll see if we got some. Any further announcements, Representative?
Just a question of the chair regarding scheduling. For the early bills, they have to be out by the 14th. So that means we will hear complicated bills and have to exec them the same day. Has there been any consideration to putting in a second day on the 13th or 14th so that if there were work that needed to be done on those bills, it could get done and we could vote on it?
There has been consideration, but I haven't decided to do it yet. If we get permission to do this, because it's a short turnaround, would anybody object to coming in for a while on the 11th, which is Monday, and Tuesday? All right, let me check on that. Thank you. Good idea. All right.
So that would mean that the early bills would be heard on the Monday and then exec on the Tuesday, which would require changing the schedule again, which is a pain in the neck, but I think it would be really wise.
What I will probably do then is move the schedule as been announced from the 12th over to the 11th. That puts all the early bills up front, and then we can get some other stuff done. And then take the leftovers from today and any leftovers from the 11th and dump them into the 12th, and we might not need the 19th.
And Mr. Speaker, Mr. Chairman, I suggest that you talk to the clerk immediately about that because they're going to have to do an addendum to the calendar because the calendar on Thursday will be too late for a Monday hearing.
Yes, thank you.
Thank
I
you.
will.
But he could do an addendum, so don't let him weasel out of that.
No weaseling. We are in a no weasel zone. Representative Leon.
Thank you, Mr. Chairman, and I thank you all for allowing me to accommodate this guy. And I'd like to say how thankful I am that there's a speaker in that office so that I can participate. Thank you.
But not me. No, I'm not the speaker. Okay. Thank
Imagine-
you. We'll be back at 1 o'clock.
Imagine if we had remote access, we could have done it from home.
Then it would have distracted me even more.
But you get dogs and cats and Representative Snow being awakened, and I mean, all kinds of fun stuff happen. What time are we coming back? 1 o'clock. Karen Abear. Abear. Okay, everybody, I don't want to whack the gavel too hard because of the child here who has fallen asleep. So, how's that, huh? Was that good?
Motion to adjourn?
Final sleeping.
No, it's been
It is not only non-germane, it is not French, and it is not Italian. All right. Open the hearing on Senate Bill 289 relative to the glucagon administration. If you remember the Biden administration and then the Trump, this is a different administration. So the chair recognizes Senator Sherman to come on up and talk to us. And I must say, I thought my wife had neat handwriting for a doctor, but this is fantastic.
No, it's not mine. That's Jenny, you know.
Okay, yep.
She knows not to let me do any writing. Thank you, Mr. Chair. And for the record, Senator Tom Sherman, District 24, 11 towns over on the seacoast, please come visit this summer. I'm introducing SB 289, and just as an aside, I always feel like I'm coming home when I'm coming to HHS, so it's great to be back with you all. This is a really awesome bill, and because it's so simple, and I don't think there's anything political about it. It is just, I'll just read the blurb. It's really straightforward. It changes the statutory reference from glucagon injections to glucagon administration under the School Health Services Statute. It allows for this for the section heading to match the language used in the rest of the statute, and also reflects that glucagon can now be administered intranasally rather than just by injection.
Would you say this is like a housekeeping bill?
Oh. Listen, I want it to pass. So, as do we all, right? Yeah. I wouldn't want to needle you with the details, but so that was pretty sharp, huh?
You were injecting comments quite
Yes,
well.
sorry.
Here we go.
I will get back on course. So this reflects current medication delivery system available, and I don't know about you, but I run away from syringes and needles. So it creates more ease and options for school nurses and students alike. And I also suspect that it will decrease the hesitancy of using glucagon when it's needed. You know, we use it all in the hospital or in the ER all the time, but the fact that it had to be given by injection to children is sort of this kind of speed bump. So the idea of being able to do it intranasally is awesome, and I think the kids agree. So I hope you'll support it. Thank you very much. Happy to take any questions.
The one question, for the sake of the committee, is you are aware that Representative Merchant submitted an amendment that arguably was non-germane. The powers that be said, well, Mr. Chair, you make the decision the way you want. So I said, heck yes. And so there's an amendment 1223. And are you comfortable with that?
You know, there's troublemakers everywhere. Yeah, I'm fine with it.
I thought so.
Yeah.
It was for them. Yeah.
I'll flog them later.
Okay, thank you. Any questions
you.
for the senator? Understand you're quite busy lately.
Yeah, I have to go down to transportation. It's interesting. My only experience in that was driving my car. So and an ambulance when I was 16. But
wow. Okay.
It'll be a new experience.
Anybody with a question for the senator? Seeing none, thank you, Senator.
Thank you.
Do we have another card for this? 289? I can lose things standing still. Did anybody else sign in?
It's right there. Yeah, 289.
Come on up, and while you're talking, we'll find your card.
It's 1404. No, this is Senator. Yes,
Mike.
Senator Sherman just did a great job of going over it, and I would not bore you except that I had prepared stuff, so I'm going to make you sit through about 3 minutes.
And you look like Brittany O'Donnell.
I am.
Yeah. That's
Thank
why.
you.
You're welcome.
You found my card.
I did. Sorry?
Yes, my name is Brittany O'Donnell.
That's what she.
So I will read my testimony for you, and then I just have a little blurb to show you. Good afternoon, members of the committee. My name is Brittany O'Donnell, and I am the New Hampshire chapter leader for T1 International, a global nonprofit organization working towards affordable and accessible insulin for all. Today, though, I'm here as Brittany, a type 1 diabetic of 32 years, asking for your support on SB 289. I was diagnosed with diabetes at 13 months old, and at the time, one of the youngest to be diagnosed in the Seacoast. There was no carb counting, no precise insulin dosing. The diet I was on was not created for children with diabetes. It was a Weight Watchers exchange system that required my mom to puree my food so I could get exactly what I needed. Nothing more, nothing less. My insulin actually came from pigs and cows at the time. There was no scanning your blood sugar or reading it from your phone or taking it manually could take well over a minute and a half just to get the results. When I was 4 years old, the kindergarten program I had been in asked my mom to enroll me somewhere else for the summer. They didn't have a staff comfortable with dealing with a diabetic. When I was 10 and my parents applied to put me into a private school, they were told they didn't have a full-time nurse and didn't feel comfortable having that responsibility. I was able to attend both of these because of my self-proclaimed helicopter mom, who took the time to educate them and to get them to see past the disease and look at the child in front of them. From the time I started daycare until the year I finished my high school, my mom used to go into each school year requesting a meeting with any teachers I would encounter. She would go over my tells of my high and low blood sugars, my ability to take care of myself, and most importantly, how they could take care of me in case I couldn't do it myself. For most people, the fear of diabetes doesn't really come from what to do when I have a high or low blood sugar. As long as I'm alert and sitting in front of you, you can assume that I'm not in grave danger and that I can walk you through it and even solve it myself most of the time. The fear is the possibility that at some point you may actually be responsible for the decision making. Most of the time there are instructions on what to do and how to provide care in different scenarios. And heck, most of the time now my machines do it for me and you. But there's still that chance that we miscalculate, or my machinery malfunctions, or our bodies just react differently and we end up in that what if situation where a low blood sugar renders us unconscious and we require glucagon. My own simple interpretation of using glucagon is this. The medication itself is a hormone. Taking the medication triggers your liver to break down an emergency storage of glycogen into glucose. The shot is given in a muscle, usually an arm, leg, or your butt, to trigger your liver's response in the quickest way possible. The shot comes drawn up with fluid as well as a vial with a solid glucagon powder. To use it, you have to inject the fluid into the vial and without removing that syringe, gently roll or shake the vial to mix it. Once mixed, you drop back the glucagon into the syringe, making sure to get all of it before you inject it at a 90-degree angle. The final step is to turn the person on their side because there's a good chance that they're going to throw up. The reaction is almost instantaneous, but it can take up to 15 minutes. So giving you all that information, how many of you would be comfortable giving me that? How many of you are trained in doing that? Aside from the size of the needle, the side effects are difficult. After getting glucagon, you tend to feel groggy, nauseous, and generally ill for a few hours. It's not caused by the quick change. It's not only caused by the quick change in blood sugar, but the lingering effects that the shot has on your body. Generally, it feels like your body is crashing from a literal sugar high. In 2019, the FDA approved an inhaler glucagon. It's used like a nasal spray and only requires 3 steps: removing it from the bottle, putting it in the nostril, and pushing the plunger for 1 dose. No mixing, no shaky hands as you administer a shot to an unresponsive child. No worrying if you can remember the training on the spot. Most importantly, it kicks in 7 to 8 minutes after use. In 2015, the European Association for the Study of Diabetes presented the data from a study that tested out both forms of glucagon in high-stress situations. The study measured how caretakers and acquaintances handled each in a simulated low blood glucose scenario. The results found that there was a 1.5-minute difference between administering the inhaler versus the injection, and 94% of caregivers gave the full correct dose of the inhaler versus only 13% when giving an injection. None of this is to say that the injection is ineffective. In fact, the injection has been around since the 1960s, and I have witnessed it being given to fellow diabetics and taught many of my friends how to use it on me in the event of an emergency. In our house, we actually keep both types handy. My husband is an EMT, so he's trained to use both and effectively in an emergency, though I have joked that if he ever uses the injection, he better be able to run quicker than I can wake up. What I am saying is that as a type 1 diabetic, I would much prefer the alternative, one that doesn't count on someone who may be afraid of needles or panic in the undoubtedly stressful situation, but rather takes the pressure off by giving them a much simpler way to save my life. With the exception of my husband and a college roommate, most others I've given the instruction to have said that they would likely opt out of trying to give me the injection at all and just call 911. With an inhaler, they just need to know where to find my purse. When the law was written in 2015, inhalable glucagon did not exist, and in fairness, only one type had for over 50 years. Advancements in the medication have finally changed, and it's time our language did. Though I know this would not have stopped my mom from calling her meetings each year, I do know that it would have provided her some relief to know that almost anyone would be capable of providing assistance if it were needed. And what an honor it would be to take that weight off of another parent's shoulders. I appreciate your time today and your support. For reference, I did bring the sweet-looking needle. So you would have to inject it into this vial.
Did you say sweet looking?
Yes, I did.
I caught
Pun
that.
intended.
Thank you very much.
I've learned you appreciate the good jokes.
Would you say that again louder?
I'm learning you wanted the room to hear that.
Yep.
So this is what the glucagon looks like. I'm very fortunate I've never had to use it. Frequently you'll find it taped to the back of a door in a nurse's office, just in case it's needed. Yeah. Schools are allowed to train people other than school nurses if they don't have a full-time school nurse to administer this and make it easier. The inhaler now looks like this, kind of like a Flonase. Yeah. It's pretty foolproof. Our language in the bill itself is really advanced when you look at states like Massachusetts, and Massachusetts, I think, doesn't even allow this for people other than school nurses. So we are already one step ahead of people. We just really need to change the title to be able to include the rest of these items and anything that they might come forward with in the future.
Will you take any questions?
I'll
from
take
this
any
crowd?
questions.
All right, let's try to limit it to medicine and health. Okay. Yes, Representative Netterupham.
So you think this is a really good idea?
I do. When down the line, and it's probably a few years out, one of the things that the creators of these glucagons, these medications, are looking to do is use microdosing. Instead of treating a low blood sugar with fruit snacks or juice and constantly feeding carbohydrates and sugar to diabetics, they're looking to find a way to give small doses of glucagon in some way, shape, or form. Because without that sugar, it's a lot easier on the body and it's a lot easier to predict. There's still a ways out, but by changing the language of this bill, what you're doing is you're allowing that freedom for the things that come down the line, so we're not having this conversation over and over.
Okay, thank you.
Representative Leon.
Thank you, Mr. Chairman. I actually used to work in the diabetes device space.
Oh,
and so that's why I noticed that you're a pumper. My question is, I guess, do you know if they're actually moving towards glucagon in the pumps yet? And I believe that we'd probably need those steps first with that microdosing that's being used separate from a closed system before we can even get to that point where the device can save the person.
So I'm not sure. There is one company independent of these two that's working on glucagon right now that has that's working on microdosing. I have friends who microdose glucagon right now off-label, very off-label, with that type of glucagon because it lasts. So once you utilize a glucagon shot, even if you don't administer the whole thing, this shot is junk after 24 hours. So either most of the time you're trying to give this person the whole dose, but even if you learn how to microdose with it, if you're sick, some of the doctors will teach you how to do it. You have to toss this after 24 hours. They're working on one that will be good for up to 3 years, I believe, which would mean that this could sit in the nurse's office for 3 years. You go in, you get your shot, it stays there. The pump, they are working, they have, I can never remember the name of it. There is one pump, we call it the bionic pancreas in the community, and they are supposedly about a year out. So I think they're working on the microdosing, and I think they're working with that other company. It's Beta, I believe. And they're trying to work on the microdosing in the pump. So I think that's why you haven't seen it come out that way on the glucagon end. Yeah.
Thank you very much for your testimony.
Thank you all. Is there someone you'd like me to give it to? I only made 10 copies. I didn't expect such a turnout for my speech, but
Well, we heard you. We heard you were coming.
I know.
Look at.
I will leave these here, but these are just copies of what I read.
Okay.
Thank you very much.
And I'm willing to bet that our wonderful friend from the fourth floor is going to turn 10 into 21. Watch how she does it. Representative Guthrie, what? Do we have a pink card for you? Is your mic on?
I didn't expect to speak, Mr. Chairman, but I couldn't let the time go by without thanking the committee, Mr. Chairman, and members for taking the amendment and considering it at this level instead of having to go before the House without the amendment. So I just wanted to thank the chairman and members of the board and Representative Merchant for submitting the amendment. And I support the amendment, of course, as did the senator. I'm not going to try to say anything after the previous speaker. I'm overwhelmed. But it's pretty clear that it's a very simple amendment. And thank you for taking it at this level.
Thank you so much. Representative Knirk?
Yes, I only just caught this. I would have asked Senator Sherman, would you believe, unfortunately, that there is an error in the numbering in the bill? If you look at line 2, it gives the new heading 200:40-B, but line 1 says amend the section RSA 22:40-B. That also should be 200. Would you believe that? I remember you were a master of the would you believe questions. That's in your honor that I ask it as a point of information instead.
I believe that you would have a question.
Yes.
Having served on this committee for a number of years. But
I know, I kept you awake all the time.
That's in the main bill. That's not in Mr.
Oh, I'm sorry. Yeah, well, that's true.
We haven't introduced the amendment.
Yes,
yet.
I didn't think we were doing the segue, so this was the main bill, but I do believe that's probably just a scrivener's error that could be corrected in enrollment, I presume, but it is not correct.
Question of the chair for Representative Weber. Are you aware if they are simply making these changes along the way in process like they used to?
I have no knowledge.
Okay. Because
but if we know that it's a problem, we ought to fix it.
Right.
It's a lot easier than finding out that they can't do it with an enrolled bill amendment.
Which means we really can't exec this bill today, it sounds like.
Apparently so.
Well, let's.
Okay.
Mr. Chairman.
Anybody? Representative Merchant?
Can someone send over a quick request to OLS to make the change and send it back to us?
We could. I assume we could, but I want you to introduce your amendment first, please. And thank you, Representative Guthrie. The reason I'm sitting here is because they couldn't find anybody else and because you said, hey, you ought to get into Health and Human Services. It's a great committee.
I'll take all the credit and the blame. So,
Okay.
Thank you, Mr. Chairman.
Thank you. This ends the hearing on Senate Bill 287 and now open the hearing on Amendment 2022-1223. The chair was given the option of how to rule, and the chair ruled it as germane, but we are being a bit fastidious in the process just to make sure.
Oh, I think I've already got this anyway, yeah.
Is she gonna enough to do that?
Erica's doing it right now.
Oh, wow, look at that. Yeah, she babysits, she amends Proverbs chapter 31.
No, but I haven't plans for any fines. I did consider the field and I did buy.
Wait, is this the same amendment as you sent out or not? Wait a minute.
Okay, we're
Okay.
in the hearing on an amendment, and this is 1223, is it?
This is on amendments, should be 2022-2141. I did not realize when you send something down to OLS.
Wait a minute. You said 2140, you mean 1241?
1241.
Thank you.
Sorry.
I don't have that in front of me.
That's
in-
what just
coming
got
up.
passed around or is being
Coming around.
passed around.
Because
I'll take one.
I found out from OLS, when you add another rep's name to an amendment, they change the full amendment, the number as well.
But it's the same language.
Yes,
So I rule this germane as well.
correct.
Since
you.
Guthrie and Pearson are on it, might as well do that. Here's my friend coming with such. So would you like to introduce your amendment, please? We need to get a copy. Okay, these go this way. All right, we're handing out copies, and if people could put them in the places of people who aren't there, such as Representative Weber, Representative Cannon, if you could make sure that she gets one too, from what's floating around here. And we'll let it float for a minute. All right, is this mine? All right, thank you. This is another one. Okay, thank you.
Does everyone have a copy of the amendment?
Does everyone have a copy of the Amendment 1241? We've also got other paper floating around too. I think we're looking good, Representative Merchant, if you would be so kind as to introduce your Amendment 1241.
Thank you, Mr. Chairman. For the record, my name is Gary Merchant, representing Sullivan County District 4, which is Ward 2 in Claremont, New Hampshire. This is a tale of two ships that passed each other in the middle of the night. What happened was we passed House Bill 143, came out of our committee 19-2, went through the House, went through the Senate. Everything was fine. In House Bill 2, what they did was they took the prescription drug monitoring program, which was anchored in 318B, and picked it up literally, lock, stock, and barrel, and moved it to RSA 129A, which is under the Department of Health and Human Services. So when this ship got to the dock, which was 318B, there was no longer any 318B under OPLC because it had been moved. So when I talked to OLS, they said, in the old days, we could fix this. But now it requires a legislative fix. And I was talking at the meeting with Representative Guthrie at the board meeting. It was brought to our attention that this was an issue. So I'm bringing it before our committee to make a simple housekeeping change. I hate to use that word dangerously. But that's what this bill fundamentally does, is allow it to be attached to 129A in its appropriate place, which is where it should have been if it's still in 318. Simple as that.
Any questions? And I believe Representative Leon, you have sent over a request for an amendment.
Well, point of information, Mr. Chairman, the clerk has said that the change for the bill itself can be done with an enrolled bill amendment if we don't have any other changes to the bill.
Well, we do. We have this amendment.
I have the language. The question is,
Okay.
should we use your amendment and just change that language in section 1 so that there's one amendment to the bill?
That would be fine. I'd be more than glad to send it back to OLS and ask them to make the change that Representative Knerk picked up on.
There you go.
Right. I can email that to them and CC you so that that can start in the process. Thank
And
you.
hopefully get it done maybe this afternoon.
Okay. And
while I have the mic before me, I want to also say thank you to Representative Guthrie for pointing it out to us at the meeting. He was there as well. He's on the board of the advisory council, And I wanted to say thank you to him for his support as well.
Thank you so much. This ends for now. What is the correct word? Is it recessing this hearing on 289?
If you're not going to have any more hearings, you can just close the hearing.
Okay, but we're going to come back on to, no, we're
That's
not.
an
We're gonna
executive
exec-
session.
Thank you. So this ends the committee thing, and would you believe the next bill is scheduled to be heard at 1:45? Walk around the building. Yeah. Well, all right, this. All right, we'll just push. It won't take long. Representative Knirk. That's what I'm counting on.
I did, and Representative Merchant is walking over there. He was CC'd on it. You're welcome.
Let's see.
That's why I waited to hit send to see if that would be amenable.
Stretch the music from Jeopardy to 11 minutes and 30 seconds. Unfortunately, we can't move ahead because the next one's been calendared for 1:45. The one on, that's the next one. And you can all read through the, hey, wait, I have a great idea. We could go back. No, wait a minute, hang on. The announcement about whether we can meet next Monday, I walked over to the clerk's office. That had already been a supplement to the House calendar. He's not prepared to do another one. So the answer very quickly is no, we will not meet next Monday. We will meet on Tuesday. Tuesday morning will be taken up with early bills from the Senate, some of which are rather involved and may be controversial. So whatever we have time left for, we'll go through the rest of the calendar and we'll take it from there. If we
Mis-
have to do it onto another Monday, we'll
Mr.
have
Chair?
time. Yes.
Is there any possibility that we could ask for time on the Wednesday or the Thursday, which would not run us into the calendar problems?
I think different people have asked me about schedule, and I think there may be a bit of a problem.
Okay.
But there it is. So if you, Christina Daya has given me wonderful things that I wasn't going to give to you until the end, because otherwise you wouldn't be paying attention to me. You'd just be reading all these wonderful things. But let me tell you what these wonderful things are, and we can actually talk about them. So I think I found the 11 minutes gap in the tape has been solved. Each person should get one. If there's a seat empty, like a Representative Gay, plop one there.
This is all the same.
Wait a minute, whoa. 13, you need to have, oh, I see what I did. You need to have 503, HB 503, okay? I need a 503. Then there's another one coming around. Well, I'm going to hold on to that one. Okay. These are bills that have come over from the Senate when the Senate amended a House bill. They came back to us in an amended form.
Of what kind? What number? 503 or? I haven't gotten anything of it.
You should have two.
Single sheet should be coming.
Does anybody over there have the extra 381s? Here we go. Here's one more. Need two. Here's two.
Yeah, right here.
Okay, right here.
When a bill comes back like this, where the Senate amended a House bill, we have three choices. One is we can accede to what the Senate amended and say, that's fine with us. Or we can say, no way, we're not going to, and that kills the bill. Or we can say, well, we disagree, but could we have a committee of conference? And then some people are appointed to the committee of conference and it gets hashed out. So I'd like you please to look at 381. This is a side by side. On the left, you see the House version. In the center, you see the Senate version. You will see that they're the same. But if you turn over, you will see in the middle, down quite a ways, the Senate added one section. A person under the care and custody of a New Hampshire County Jail or Department of Correctional Facilities shall be excluded from the provisions of this section. That's the only addition they made, and the chair would like to know what your sense is. Do you like the Senate change? Do you dislike Representative Knark?
Actually, there is one other one that isn't highlighted. The very last one, the effective date is changed, but that's trivial.
Yes, that is true. Representative Nadarapam. Yeah. Costs us a lot of money.
So
Get that mic.
why would they prevent someone in prison from accessing some kinds of tests?
I don't know.
I would. Oh, sorry.
Representative Knark.
I think what this has to do is people in the Department of Corrections, they're responsible for their medical care. They can't just go out to the corner somewhere and get medical care. And so I think the point is they need to keep control. How would they be doing various testing and ordering things up and getting blood drawn to get sent there? They don't usually like extra needles over there, I don't think. So I think that's probably what it is.
Representative Woods. Waving off. Oh, I say Representative Weber.
And remember, this is not preventing people from getting lab testing. It's just, this is the one that's without a medical practitioner's order, and it's people who are going to be private pay. I'll say for myself, Mr. Chairman, not anybody else, that I was against the bill when it started, and I'm still against it, but I don't think the change is anything that makes a huge amount of difference.
So I need a sense of the committee. I don't think it's a vote, is it? It's a recommendation to the chair.
That would be a matter for whatever policy the current speaker has set. When it was Speaker Norelli or Speaker Shurtleff, the committee had to actually take a vote.
Under the present speaker, he said, Mark, do what you want with them. So what I want to do is get advice from my distinguished colleagues. Representative Knark.
I would repeat precisely what Representative Weber said. I was against this bill when it first came out. I'm still against this bill, but this is not the deal breaker. This doesn't change my thought on the bill at all. So I'm comfortable with this change if we have to have the bill passing.
Representative Nadarapam.
I know I'm chatty today. I have made use of tests that were not prescribed by my prescriber to get more clarification. So I'm, a responsible adult mostly, and so I'm in favor of this bill. And although I feel a little bad that if somebody in prison was worried that they had something and they were being ignored by their providers, that they would be excluded from this, but I will vote in favor of the change.
This is really a sense of the meeting to give me guidance. It's not a vote. Representative Leon.
Thank you, Mr. Chairman. I do think that I have also done sort of the labs without prescription, but they actually ended up contracting with somebody to do it. It required me to go to that facility, and I'm not sure how somebody who's incarcerated would be able to go to a private facility to do that. So I think that they're probably, I know with some of the other bills, they had talked to us about excluding people in the prison system that are incarcerated, because otherwise they might take it as a reason that they can push in order to get out when they otherwise aren't allowed out. So while I do want to provide that flexibility to them, I understand why it's added, and I don't see a problem with it personally.
The clerk of the House has just texted me saying no vote is needed. It is recommendation. So just ask, how many of you, just a show of hands, would be in favor of acceding to the Senate version? And how many of you not? Okay, that's advice to me. Thank you. All righty, we'll do the other one later if we have time. Open the hearing on Senate Bill 404 FN, establishing a supplemental nutrition assistance program. This ought to be a snap.
I appreciate any and all puns. Good afternoon, Mr. Chair, and good afternoon, members of the committee. For the record, my name is Becky Whitley, and I am honored to serve New Hampshire Senate District 15, including the wonderful communities of Concord, Henniker, Hopkinton, and Warner. So I'm honored today to bring forth Senate Bill 404, establishing an outreach program in the existing SNAP program in New Hampshire. So I'm sure folks on this committee are well aware that food insecurity is still an issue that we struggle with in New Hampshire. And unfortunately, it has only worsened since the pandemic. We know that our low wage earners have been particularly impacted by food insecurity because of things like stagnant income growth and, of course, our high costs of living in the Granite State. But thankfully, the federal government provides support to address food insecurity through the SNAP program, the Supplemental Nutrition Assistance Program. And folks are probably well aware of what that program does, but it provides essential nutritional aid to individuals and families throughout New Hampshire. These benefits, it's important to know, are federally funded and dispersed to eligible New Hampshire residents who may be experiencing food insecurity. So despite what we know is an ongoing need for nutritional assistance, there was a report issued by the New Hampshire Fiscal Policy Institute on July 15th, 2021, and that report showed that there are more individuals in New Hampshire, there are more eligible individuals in New Hampshire than are enrolled in SNAP, meaning we have a lot of people in New Hampshire that are eligible and are not enrolled in SNAP. And I say that because there are some trickle effects from that. So there are estimates that up to 17,000 children in particular are eligible for SNAP and not getting it. That means we have children who are food insecure who are not getting this aid. Now, to me, that's a problem that's really screaming for a solution. So not only are 17,000 children not getting the aid that they're eligible for, thousands and thousands of adults aren't either. So this same analysis from the Fiscal Policy Institute, which I'm happy to send to the committee, detailed that if these 17,000 children had been enrolled in SNAP in 2019, and each child was in a separate household that received the average benefit amount during that year, then additional $37.9 million in federally funded aid would have flowed to New Hampshire to support those families and to support our economy. So this estimated under-enrollment may have resulted in folks not getting this important nutritional aid, but of course this was less money in economic stimulus that was flowing into our state during the pandemic and to our local economies, to our local grocery stores. In this analysis, the Fiscal Policy Institute detailed that levels of under-enrollment in nutritional aid, of course, continued through the pandemic. We know that those numbers didn't get better during the pandemic, right? Data collected by the U.S. Census Bureau showed that significant portions of New Hampshire population faced declining or lost incomes and challenges affording expenses in food, even while enrollment during the pandemic declined. Again, this is a problem crying out for a policy solution. So thankfully, the federal government does give the state flexibility to expand eligibility for SNAP and to conduct program outreach, which helps ensure that information about benefits, information about eligibility is available to residents who may qualify for assistance. The federal government reimburses states for half of the costs associated with these outreach programs, so long as those costs are part of an outreach plan that's approved by the government. So they allow states to do that, but it has to be a plan, part of a plan that's approved by the government. And not only do they allow this, the federal government actually encourages these plans because, of course, they help improve program participation and get more stable food access to people. So unfortunately, New Hampshire has not had an outreach plan for 5 years. The last approved outreach plan ended in September 2017. And so outreach to eligible granted-staters, I believe, can also help disproportionately impacted folks move ahead during this crisis. We know a lot of people were disproportionately impacted by everything that happened during the pandemic, and I think we have an obligation to sort of find those policy solutions to get them back on track. So the bill before you is a very well thought out proposal. There are a lot of very smart people, advocates that worked on this bill. It also has bipartisan and bicameral support. So I think that speaks to how important this policy is and that it's really ready for prime time. So thank you for your consideration, and I'm happy to take any questions.
Representative Folsom.
Thank you, and thank you for taking my question. Where could we find out what kind of plans are approved by the federal government? Like, do they have guidelines for establishing the plans so that they'd fit their?
Thank you for that question. I am not the best one to answer that. There are some nutrition experts. DHHS might also be able to answer that question because they did have an outreach plan in the past.
Thank you.
Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you for taking the question, Senator. This may be similar to the other question. Do you know if they're going through individuals' financial records in order to identify them for that outreach, or if this is more of a messaging and advertising approach through these outreach plans?
That would be a good question for the food bank if they were here.
Okay. Then I will defer to them.
Okay, thank you. Thank you for that question. I will say that the New Hampshire Food Bank has participated in outreach, significant outreach in the past, present, and so they are really the best folks to talk about the details of the plan and how that might work.
Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. I'm hidden
Okay.
over here. Sorry.
Hello, Representative.
They hide me for good reason. You mentioned a hiatus about these programs. Was there a problem that needed to be addressed in the absence of these programs? Why were they discontinued?
I don't really know the answer to that. I know folks from DHHS are here. Of course, DHHS has a whole host of responsibilities, and I don't really know why the outreach plan was discontinued.
Just like Einstein said, you're doing the same thing over and over and expecting a different result. Is there something we needed to change?
Thanks.
I have a question here on the second page under methodology, perhaps a little unpacking on your part, if you would. The paragraph that begins at the very bottom, the department notes that in its normal course of business, it already plans to apply for a SNAP outreach plan. That makes me want to believe that some of the stuff that's listed in the bill is unnecessary, but I'm not sure of that.
Thank you for that question. And, I think I'm glad to see that, but unfortunately we haven't had a plan for 5 years. The SNAP program is established by state statute. And so I think if the legislature thinks it's important to have this component of it to reach who's eligible, then I think the legislature needs to speak on the need and the importance of an outreach plan.
Even though the department's planning on doing it.
I mean, plans change, look, differing responsibilities, we heard, it could be that, this takes not a priority. I mean, I think that's fine if they're doing it. I don't think that impedes what we're trying to do here. I just think it puts a legislative imprimatur. We have 3 branches of government. I think it's important for the legislatures to speak on this.
And then the end of that paragraph, this bill indicates that the resulting plan would not be implemented unless its costs were fully funded by private or federal sources. In other words, no charge against the state budget, at least right now.
Thank you for that question. Yes, this has been a really collaborative bill. If there is a state match for this, and there are already private funds identified for that. And I think other folks can speak to that as well.
How can it be fully funded by private or federal sources if there's a match by anybody?
The private entity would provide the state match.
Thank you. Representative Cushman.
Thank you, Mr. Chairman. I believe you answered my question with your last statement, but just to really tie it up for my own understanding and maybe someone else's. So really the difference between the plan, the outreach plan application that will be submitted by the department and this one is that the one that the department would be submitting would use their existing budget, and this bill requires that the funds come from the private and federal sources.
Was
Is
that a
that
question?
correct?
Yeah.
That's my understanding.
Representative Leon.
Thank you. And pulling on the same thread, I see on page 1, line 8 and 9, it says nothing in this paragraph shall be construed to prevent the department's use of available general fund appropriations for the purposes of the paragraph if there's insufficient federal or private funds available. So it seems that would this be enabling in order to reach for those private funds?
Yes.
Okay. Thank you.
Any other questions for the senator? Seeing none, thank you, Senator.
Thank you. These were wonderful questions. I appreciate the time.
Keep those puns coming. Chair recognizes Elise Bolster from the New Hampshire Food Bank.
Hi, Chairman and committee members. As you mentioned, my name is Elise Bolster. I'm the registered dietitian and nutrition programs manager here at the New Hampshire Food Bank. You had some questions, which I'm happy to maybe address first, or we can save them for the end. I have something written here. I think it'd probably be more helpful if I read it.
Well, we don't like long read stuff.
It's not long.
Okay.
Yeah, I'm here today with my coworkers, Jennifer Lennox. She is our SNAP outreach coordinator. She does some of the outreach that we're currently doing at the New Hampshire Food Bank to ensure those who we serve through our agency network do know about SNAP and can access SNAP applications through New Hampshire Easy, which is through the Department of Health and Human Services, or they could call her, especially if they don't have access to computers or electronic devices to apply on their own. They do need that resource to go through that process and to have someone on the other end of the line that can actually help them through that process. I think we can all relate to a frustrating conversation with someone on the other end that's not understanding us or not helping us through our processes. I wanted to define food insecurity for you, food security, which is having enough consistent access to food for an active, healthy life. I can imagine many of us have experienced hunger at some point. I was hungry before I ate breakfast this morning. Food insecurity, I'm fortunate not to have experienced firsthand, but food security is, as I said, consistent access to enough food for an active, healthy life. And I think some of those words within that definition can resonate. Consistent, enough, healthy. The mission at the New Hampshire Food Bank is to ensure that all New Hampshire residents are food secure. Anyone who is eligible and enrolled in the federal Supplemental Nutrition Assistance Program, also known as SNAP, are able to choose for themselves which foods to purchase, how often, and how much of those foods. This monetary supplementation, again, supplementation, it's not to purchase all of their groceries with, it's usually not enough, provides dignity, choice, and options to New Hampshire residents on how they nourish themselves and their families, and helps us work towards our mission of ensuring those who are around in our communities are food secure. Without clear and trusted awareness and knowledge of SNAP's existence, how to apply, learning how one might be eligible, or where to call or go to receive help, our New Hampshire residents cannot access this resource, and in turn might might be left without the sufficient food resources for optimal health. As much as the food bank would like to provide all of the resources at all times to all of the individuals in the state, we cannot carry this weight for those who are food insecure, and cannot carry the entire weight for those that are food insecure. And this plan is the federal safety net to ensure that, you know, this program is helping to carry that weight. SNAP Outreach provides the foundation for this program to be successfully utilized. And just, we hope you consider the fundamental need for the statewide plan so that all can know about what resources are available to obtain this basic human need. And I can share a little bit about my background at the food bank, which is that I wasn't here when the last outreach plan was in place. It was contracted through the New Hampshire Food Bank. I started in 2017 as a coordinator and became manager at the end of 2019. So a lot of this wasn't in play when I was manager, and something happened between 2017 and 2019. Not to say that we have to be the contracted agency in the state. I think as far as the state goes, they can send out an RFP and anyone can apply to be that contractor. The New Hampshire Food Bank is more than willing. It's, like I said, part of our mission, and we would love to be able to access those resources to ensure that all of our agencies and the network that we serve that are food insecure know about this resource that can allow for them and themselves to purchase the food where they want, when they want, and how they want to purchase them.
Questions? Seeing none, thank you so much.
Thank you very much.
And the chair recognizes Laura Milliken from the New Hampshire Hunger Solutions. Now, I'm going to ask you, if you would, to remove your mask and turn the mic on so we can hear you. There we go.
So, good afternoon, Representative Pearson and honorable members of the committee. My name is Laura Milliken. I'm the Executive Director of New Hampshire Hunger Solutions, a nonprofit that advocates to end hunger in New Hampshire. Ongoing statewide SNAP outreach is critical. Eligibility for the program is set by states, so New Hampshire should ensure that our residents who are eligible for SNAP know it, know how to apply, and can benefit from it. Ongoing outreach improves the state's ability to educate residents about eligibility rules, ensuring the program's integrity. We know that New Hampshire is now 39th in the nation in SNAP participation. The majority, or 60%, of eligible older adults are not currently enrolled. As many as a third of eligible children are not enrolled. In the week ending March 14th, 2022, over 55,000 New Hampshire residents said that they did not have enough to eat. That's more than the population of Concord. In that same week, 25% of New Hampshire adults reported that it was somewhat or very difficult to pay for usual household expenses. That's over 241,000 people. And these numbers are from the the U.S. Census Pulse Survey. The rising inflation that we've all experienced is also affecting food prices, which have increased over 6% in the last 12 months. We are simply not reaching all those who could benefit from SNAP, and it's clear that the need is great. Statewide outreach is critical to ensuring public resources flow equitably. And we know that outreach works. Studies show that data-driven outreach and application assistance increases participation more than 7 times in adults over 65. An outreach plan codified in legislation will have the effect of saying that we in New Hampshire believe that addressing hunger is a bedrock value. We applaud New Hampshire DHHS for its recent stated commitment to submitting a SNAP outreach plan to the federal government this year. We also support this legislation as it will ensure that all future administrations do the same. New Hampshire has failed to submit a plan since 2017 with clear negative effects on hunger in the state, and this legislation will ensure that doesn't happen again. So this legislation requires the state to file an outreach plan, but not to implement or administer it. unless they receive private or federal money sufficient to cover the costs. 50% of the funding is already assured as the federal government provides the 50% match. Now, while the state must submit the plan in order to access that 50% match, because nonprofits can't do that, the bill puts the burden of raising the rest of the dollars on nonprofit partners. The bill is modeled after a Nebraska law where the Nebraska Food Bank for the Heartland raises the money for outreach and administers the outreach program. The state's only obligation is to submit the plan. It's entirely revenue neutral. SNAP not only keeps our neighbors from hunger, but communities gain from the multiplier effect of SNAP dollars being spent in the local economy. For every SNAP dollar that comes into the state, it's estimated to stimulate $1.50 or more in local economic activity. So, for example, as Senator Whitley said earlier, the New Hampshire Fiscal Policy Institute estimated that 17,000 children may have been eligible for SNAP benefits in 2019, but were not enrolled. Now, if they had been, that would have brought nearly $38 million in economic stimulus to New Hampshire in a single year. Our system of food and nutrition supports is like a power grid that moves nutritious food to communities throughout the state. But that grid is now patchy in some communities and non-existent in others. This bill will help us plug more communities into the grid, ensuring more children, older adults, and other eligible Granite Staters benefit from the nutrition support that they deserve. Thank you so much. Take any questions.
Any questions? Representative Leon.
Thank you, Mr. Chairman, and thank you for taking my question. I hope you can answer what I have to ask here. Do you know if the outreach would be specifically targeting households that have been identified as having the earnings level where they would qualify, or if this is a broader outreach that's not targeted to specific households?
So, thank you for the question. I think that we would want to broadly target the outreach. I don't know that we even have the ability to target as you indicate. I think we could use census tract data to show what areas people might live in who are SNAP eligible. But the idea is not to in any way stigmatize anyone. The idea is to make sure that the people who need SNAP can access it.
Follow up?
Thank you, Mr. Chairman. So you don't know of any plans taking Medicaid benefits or anything else like that to personally target any of these families?
I see what you're saying. So you're talking about Medicaid direct certification. So I'm aware of Medicaid direct certification for free and reduced meals, not for SNAP.
Well, the privacy issues of that were a concern to me, especially families that don't want to be identified that way. So I'm trying to learn more. That's why I'm asking these questions.
I see.
So,
I mean, that's
you.
an interesting way of looking at it. I sort of see it a little bit differently, that's families who have already submitted information for Medicaid would be told that they are also eligible for other programs, which gives them the option to enroll or not.
So you would be in favor of using that information to reach out specifically to those families?
So the SNAP outreach bill doesn't have anything to do with Medicaid direct certification.
Thank you.
Any other questions for the speaker? Seeing none, thank you so much.
Thank you.
And now, the chair recognizes Karen Hébert. Bienvenue, Madame Hébert.
Merci.
Don't tell me it's Hebert.
Merci.
Bien.
Good afternoon. My name is Karen Hébert, or if you're not French or from Canada, it is Hebert. Thank you. I am the Director for the Division of Economic and Housing Stability for the Department of Health and Human Services. It's a long title. I have to take a breath in between. So I do want to note that the department respects the policy support of Senator Whitley, as well as the support that we have been getting from a number of food advocates across the state. So I do recognize that. And the department does agree that an outreach plan is extremely important to the families in New Hampshire, especially with our increasing and recent rising food costs.
We were approached by a number of the food advocates as well as New Hampshire legal assistants, really supporting and encouraging the department to conduct further outreach for the SNAP program. And while the caseloads in the department for SNAP were encouraged by a slight increase that we have seen in the last month, what we didn't really see was an increase in the need during COVID. So during the last 2 years, the caseloads remained relatively steady. So that's certainly something we made a note of. So we've been currently analyzing some of our own data, including very recent survey data, as well as other data that includes work done by the New Hampshire Children's Health Foundation, and find it very informative. So we started a while ago to initiate a request for proposals rather, through the department's procurement process for a SNAP outreach plan. While we're in the middle of that procurement, so I'm a little restricted on what we can disclose about that at this time, we do basically agree that an outreach plan is helpful and essential for our families. A couple of technicalities I just want to point out that are in the bill. One of them being on line 13 of page 1. It refers to that upon approval by the federal government of an outreach plan, that the plan shall be implemented within 3 months. And I just want to point out the procurement process that includes developing those contracts. It's entirely possible it could take more than 3 months, and I don't want to get us in trouble, if you will. So I'm wondering if it would be acceptable to make an amendment to that time frame so that we're not restricting ourselves based on a process that we don't always have control over, that is also subject to governor and council approval for all of those contracts. A second technicality that I want to point out is on line 24, which that particular fiscal year, 2023, actually refers to the state fiscal year, and I wanted to ensure there wasn't confusion over that versus federal fiscal year. The deadline for the USDA's, it's for our submittal to the USDA for an outreach plan, is August 15th of every year. So the deadline for August 15th of 2022 runs in state fiscal year 23. The last thing I want to just note is that while we have been initiating the current outreach plan using existing resources in the department, if the bill were to pass, I do note that it refers on line 24 to this as being annually or as required by the USDA thereafter. It is entirely possible we would seek resources through the budget process for continuation of an annual support for an annual plan, and we would seek that in the next biennium budget. We also don't know at this time. We will be putting together relative projections for the 24-25 budget based on how successful the outreach plan could be. So we can make projections on perhaps the increase in applications, the increase in eligibility determinations that our eligibility staff would have to process. And if we are very, very successful, we will need further resources for that. We're hoping for success with this.
Representative Weber.
Thank you, and if I may, Mr. Chairman, I have a couple of different questions. The first comes from your testimony about line 13. You said that 3 months might be too limiting. Do you have a time period that you're comfortable with?
I would recommend 6, just in case. I don't know that we would need that, but I'd rather be safe than sorry.
Thank you.
Follow up.
And
Second
then
question.
on line 24, you want the insertion of the word state fiscal year, or do you think that now that you've explained it to us, we're okay?
I think it would be helpful for that clarification to, and Senator Whitley did support that as well,
Okay.
to include the word state.
Okay. And then just you made some sweeping statements at the end about needing more money, but just so that I am clear, we're talking about two different things. One is the program itself, which might need more money. But what we're talking about in this bill is simply the funds for the outreach. Is that correct?
So the funds for the outreach plan itself. So what I'm talking about are, yes, a couple of different things. So resources that the department needs in order to pull a plan together and do a procurement process for that plan. So that does take resources to be able to make that happen. So if this were to be an annual initiative for the department, we would certainly look at seeking an additional resource for implementing that on an annual basis. Right now, we are using an existing resource that we have until the end of April. But after that, we will no longer have that resource. So we will look at incorporating something into the next budget for that resource. The funding for the plan essentially comes from the federal government that pays for 50% of eligible activities or allowable activities. And what we anticipate is that the other match would be raised by the programs that bid on the on a contract for that.
Thank you.
Any other questions? Representative Knurk.
Well, then a follow-up on what what Representative Weber was just asking. Would you be happier if we did not have that reference into annually so that you're not obligated to do it annually, since it may not be something you would wish to do on that basis? In other words, if we're going to get an amendment, we might as well fix all the language pieces in there.
I think the department will be neutral on that, because I think that while the concept of having an outreach plan, I understand the necessity to it and support the need for further outreach for families, but at the same time, I want to ensure that we have the resources in place to make that happen and make it successful. So the outreach plan, the program from the federal government is voluntary. It is not a requirement by the USDA to conduct outreach. But the state certainly sees the importance to it, which is why we initiated it a little while ago.
Follow up?
I think I understand that, but you, as you point out, you wouldn't want to do it unless it's successful, but I'm concerned about the language here says as well as annually or as required. But if you felt that it would not successful, so you did not wish to do it annually, is there an escape clause here because it would only be if it were required?
I think the or as required probably suits that just fine.
Thank you.
Representative Weber.
So do we actually need this legislation at all? Is this not something the department can just go ahead and do without enabling legislation?
So while it is voluntary, it's a voluntary program from the federal perspective. The department has been neutral on whether or not this, the department is neutral on whether or not we move forward with legislation on this particular bill.
Could I have a follow-up?
You may.
I understand that you're neutral on the bill. My question is, it appears from statements made in the methodology and statements that you just made that the department can go ahead and do this program whether we have a bill or not. Is that correct?
That's correct.
And the issue is whether the program will be initiated within the parameters of what the legislature has outlined here, or whether the department will just continue with it or not continue with it at the department's own initiative.
Yes.
Oh, could I have one more?
Let me follow up to your follow up, and then you can follow up.
Okay.
So this really means if the bill doesn't go anywhere, it leaves the department with a lot more flexibility on how to do pretty much this stuff. Whereas if the bill passes, it starts restricting it. Am I right?
I don't know that the bill restricts what it is that we're doing any. I think
Okay.
that it just is presented as a supportive policy from the state to encourage the department to continue having an outreach plan for SNAP.
Follow up, Representative Weber.
I was reminded that there was a question a while back saying, why was the program discontinued 5 years ago? And it's clear to me that if we have it in statute, then the program is not going to be discontinued unless the statute is repealed. Was there a statute, if you know, was there a statute 5 years ago and was that repealed, or did the department simply discontinue the program, and if so, for what reason?
I believe the latter. I'm not aware of any statute previous to this that was repealed. And whether the department would discontinue the program without legislation in place, it's a little tough to predict. The department certainly has a number of competing priorities and only so many resources. So we look at really that's an ongoing strategic plan.
Who has a question? Representative Cushman.
Thank you, Mr. Chairman. So just to clarify that last statement, so was the reason that it was discontinued before because it was not strategically prudent?
I would be happy to find out that specific information because I was not in this role at that time. So I'd be happy to get back to you if that's okay with you. Okay, great.
Thank you so much.
Thank you.
Coming. Is there sentiment in the committee for someone to write an amendment changing the 2 or 3 little things that we noted? Representative Knark?
Yes, I'll do that for you. I just want to, if we could take a moment to make sure that I have them both. It was the line 13 and the line 24, adding the word state and changing it 6 months in 13. Did anybody have anything else? Please let me know before I start preparing it. Particularly Representative Weber, who usually figures everything out. Oh,
Representative Cushman.
If I may, you also made a remark about the word annual and striking the word annual so that they weren't bound to do it annually if they find that
yes.
it's not worthwhile.
May I respond?
You may respond.
Well, except as Ms. Hebert pointed out, that says annually or as required. So there is an escape clause that gives an option, line 24, as well as annually or as required. So since it's not a requirement, but it's an option, it seems like they have the flexibility that they would need. So she said that she had no objection to leaving the word annually in there, as best I understand.
It's always good when people are happy, and it looks like the House Committee Services are happy to provide a legislative history on this kind of a thing. We were asking, were there such, and we want them to be happy. So we will, it looks like we will wait for a couple weeks before we exec this. So let's postpone this to the meeting on the 19th. And Representative Knark, you'll be coming in with an amendment for us.
Yes, will do. Thank you.
This concludes the hearing on Senate Bill 404. And I now open the hearing on Senate Bill 439 relative to the Brain and Spinal Cord Injury Advisory Council and Community-Based Support Program. And the chair recognizes Senator Gaida, the prime sponsor.
Thank you, Mr. Chairman, members of the committee. It is good to be back in my old stomping grounds, at least
Where's
for
that?
now.
Where's your old stomping grounds?
Yes.
Okay.
So, my name is Bob Gaida. I represent District 2, 27 communities up in the central western part of the state. And I am prime sponsor on Senate Bill 439 FN. This bill is a result of a long progression of things. It began with my wife's tragedy that brought me into contact with the Brain and Spinal Cord Injury Advisory Council. A very well-intended and very dedicated group of volunteers. We had a number of discussions at their regular meetings, and the need arose very clearly to streamline the council because it had too many members, they couldn't get a quorum, and those types of things that I think you see as well sometimes from time to time. And so this bill is the result of the consensus of that council, okay, as to what they would like the council to look like going forward. It addresses some things that were, if you will, again, well-intended but dysfunctional. Takes those out, and I'd be happy to answer any of the any of those, to any of the things in the bill that any of the members of your committee have to ask. Again, it doesn't establish a committee; it just takes and cleans up the bylaws and of the existing committee.
I'm pleased to know there's only one House member appointed to this.
It will be you.
I know that. I didn't mean that as much as I have to go looking for other members. Senator Gaida, there's a few things now I'm very keen on when I see committees and commissions and councils. Having spent several months with the Education Commissioner trying to rescue a law because it was extremely unclear as to how we should go forward. So I got appointed to that as a citizen. And so now I'm very careful to look. I don't see in here, and help me, I may have missed it, who is the convener? Who calls the first meeting together?
Well, Mr. Chairman, if I may, this council already exists.
Okay.
So
it
the
doesn't.
current chair, Jim Peets, an incredible man with an incredible disability that he has managed to overcome. I mean, incredible is an understatement. Is the current chair, and he
Okay.
calls them as
It was too obvious why it wasn't there. I missed that.
Yeah.
And also, therefore, who will elect the chair? That's already going on. The one thing that seems to be missing is mileage for legislators.
That may already, or as far as, well, again, this doesn't establish a committee. The mileage for
Okay,
legislators
so that may already be in
is
there.
already in there.
Okay.
Yeah. Yeah.
Just in case.
Yeah.
Any other questions for Senator Gaida? Oh, yeah. Representative Weber.
I actually had one, but then I think I've read a little more carefully. I was going to ask if the Commissioner of Health and Human Services and the people following him could designate an alternate, and I noticed that is headed by the following persons or their designees, so they can, which is always one of the issues when we have large committees and commissions. There's only so much time that the commissioner can spend in committees and commissions and get the rest of their jobs done. So, but the designees are already there, so that's okay. Thank you.
Representative Snow?
That was the same question
Okay.
I was going to ask.
Representative Knirk?
Yes, hiding over here. I had a couple of questions. One was I did notice sorry, I had to step out for a moment. I might have missed this if you said it. On page 2, line 4, the chief of Special Education Bureau is removed. I was curious why that person would be removed, since it seems like special education would be an area of quite big interest in this. Or is it just because they were never attending?
That was one. The other reason is, again, this is a council that comes forth with recommendations. Those recommendations will be delivered to Department of Education, Health and Human Services, and so forth, as would be, as the report would indicate.
Okay. Follow up?
Follow up.
Another one was, I did notice there was also language in here about removing issues about grants and gifts, and I was wondering why grants and gifts were being removed. I've forgotten now which line that was. It's on page 3, line 11 through 13. So they were authorized to solicit and receive any grants or gifts, and that's removed. And I was curious why remove that.
Those grants and gifts should go to HHS because the advisory council doesn't have fiduciary authority statutorily.
Okay. And one last one?
One more.
Okay. The last one I had was one that actually kind of troubled me the most. There was also removal in the duties about issues about prevention. That it seemed like we were taking away any work for prevention work. And I was curious why that.
Well, again, the focus of this council is for the survivors of brain injury and spinal cord injury. It does not look at prevention. It looks at programs. For example, in the last budget, we appropriated $200,000 to develop a training center for mildly brain injured folks down in the central part of the state where one currently doesn't exist. But this is all after the fact of the brain injury. That's the purpose of the association. Certainly to discuss, preventative measures, but the focus is almost completely on how do we now help these folks that have been afflicted.
A follow-up to that.
Sure.
Was the initial legislative intent, though? I mean, usually the duties are put in the legislative intent of the initial bill. Was the initial legislative intent for it to be dealing with prevention, and it just evolved to the point that it wasn't doing that, so might as well get rid of it, or was that not the intent?
I don't believe that was the intent.
Okay, thank you.
Again, this was formed because people with brain injuries had nowhere to go, no resources available. And so it's managed to work. I got to give full credit to Steve Wade and Jim Peets. Steve is the head of the Brain Injury Association in New Hampshire. And he has done yeoman's work in coordinating with DHHS and any other of the agencies in getting this bill put together. So kudos to him and that organization, which does incredible work for people that are suffering some pretty terrible afflictions.
Any further questions for the senator? Representative Cushman.
Thank you, Mr. Chairman. Thank you, Senator, for taking my question. I noticed that this repeals the brain injury registry. Can you tell me a little bit about that? How long it existed in statute, and was it ever implemented? Did it ever get up and running? Do you know?
I think I don't know the answer to those questions, but from my discussions with the council, it was basically dysfunctional. Anyone that has a brain injury is either known already, so this is that would have been a redundant thing. The Brain Injury Association keeps a very close track of people. I'm not sure of the state's resources in that capacity, so I'm not able to answer that.
Okay, thank you.
Sure.
Seeing none, thank you so much.
Thank you, Mr. Chair, members of the committee.
And the chair calls Stephen Wade of the Brain Injury Association of New Hampshire. And since I'm trying to enter you into my phone, would you repeat the phone number you've got down here? Because there's one number I don't quite. Microphone, please. 603 568.
There it is. It's red now.
603 568.
Yes. 9221.
Thank you so much.
Yes. Chairman Pearson, members of the committee, my name is Steve Wade. I'm the Executive Director of the Brain Injury Association of New Hampshire, and I can try to answer some of those questions as well that were asked of Senator Gaida. But I'm here on behalf of our member families and survivors, certainly strongly supportive of this legislation and some of the changes to the council. So I think one of the major roles of the council over the years has really been to try and identify some of the gaps in services and unmet needs of people living with brain injury, which has been very much an underserved population, particularly children with brain injury, and especially children with co-occurring brain injury and neurobehavioral health issues. So the council does a lot of work in terms of holding hearings and listening sessions and working with the support groups, all as volunteers, again, trying to gather information for an annual report that goes to the legislature and to the Health and Human Services. So there were, actually, I also have a letter from Jim Piat. Jim, Senator Gaida mentioned that Jim is currently the chairman of the council, and if it's okay with you, I'd like to read that letter of support.
If it's brief, yeah.
It's very brief,
Okay.
actually. My name is Jim Piat. I am the chair of the Brain and Spinal Cord Injury Advisory Council. The council has been in existence since 1997 when it was established by statute RSA 137K. I'm writing on behalf of the council to ask for your support of SB 439 FN, an act relative to the Brain and Spinal Cord Injury Advisory Council and community-based brain injury programs. Our council's been working with Senator Gaida on this proposed legislation that would streamline the council membership and continue our work in a more effective manner. If you have any questions, please contact me, and he lists his phone number. So actually, I have copies of the letters of support. I probably should have given these to someone, if I could pass them over. But in terms of answering some of the questions, would it be okay if I took a stab at that? I know there was a question
Sure.
about the registry. I know when the law was originally passed, establishing the council, there was talk about actually putting together a brain injury registry modeled after some of the other registries. And I know at that time the legislature was concerned about issues of confidentiality. And I think the feeling was, could we do this without actually having a formal registry? And I'm pleased to say that it has been very successful. Health and Human Services developed a program called, the acronym is WISDOM. I'm not exactly sure what it stands for, but one of the major purposes of registries, of course, is to put together your incidence and prevalence data for the state. So the Health and Human Services does have that data and produces it not on an annual basis, but on a somewhat regular basis from hospital discharge data that the state has. The other purpose of the registry was to link newly injured folks up with state services and community-based services. And Health and Human Services did fund through the Bureau of Developmental Services essentially navigator positions, neuro-navigator positions to work with folks, again, looking at the post-acute long-term chronic phase of brain injury. The hospital, your hospitalization is just the start of really oftentimes a long journey. So, and those resource navigators work very closely with all the acute rehab facilities in New Hampshire and many of the hospitals to work with newly injured families to help them identify services at the community level. So essentially, although we don't have a formal registry in New Hampshire, all the functions of a registry are being accomplished. And that's probably fairly typical of other states as well, particularly our neighboring states. So there was one other question besides the registry that the prevention question, I think. There is a lot of brain injury prevention work being done, and it's primarily being done by the Injury Prevention Center up at Dartmouth, as well as I know Health and Human Services has some injury prevention work as well. And then the Brain Injury Association does a lot in terms of injury prevention. But the core focus of the council really has been to try to identify unmet needs of folks living with brain injury, those who've already sustained an injury. So I hope that helps answer a question. So, and I'm happy to answer any other questions that anyone may have. So,
Representative Knirk.
Thank you. And actually, it was not until after Senator Gaida left the chair that I realized there's still kind of a bit of a follow-up on that chief of the special education. He commented that this particular council comes up with recommendations, and special ed would be more of something that implements it. But yet, when we come up with a recommendation, we don't want to come up with a recommendation that can't be implemented. Right. Is it not helpful to have those who have to implement be at the table to make sure that what we draw up is still effective? Again, I don't know the internal workings of it. So if you who have been there still feel it's better not to have that person, I would understand. But I just have wondered why. It just struck me as funny because it seems like they have a large role.
No, certainly, again, brain injury affects children perhaps more so than adults. And New Hampshire actually has a code within the IDEA for acquired brain disorders. It was originally just traumatic brain injury, but I think New Hampshire took a very positive, progressive approach and really broadened that coding. So children with brain injury are being identified. I think the reason that particular category was taken out is because there is already representation from the Department of Ed on the council, and oftentimes folks from Department of Ed will be called in as specialists if there are specific questions. But there is in fact, Jim Piat himself, the chair, works for the Department of Education, through Voc Rehab. So
understood.
So.
Any further questions? Thank you so much.
Thank you very much.
This ends the hearing on Senate Bill 439. I'd like to go ahead and exec this one. I don't see that we should have too much trouble doing that. So open the exec session on Senate Bill 439, and the chair calls on Representative Folsom for a motion.
I move ought to pass on Senate Bill 439.
Do we have a second from over there, Representative Knirk? Now, discussion. What? It's okay. It's okay. You were discussing meaningfully. Yeah. Anybody want to share, speak, talk, ask? Representative Cushman.
Thank you, Mr. Chairman. I'll try to make it brief. I was speaking with a member of the community who is a brain injured person who's dealt with the BAA of New Hampshire and has been privy to what's going on with this registry for a while. And apparently the law was passed in 2000 and it never came to be. And I guess they're basing their surveillance now off of data from Wisdom, but DHHS has reported that it's not capturing all of the brain injuries and spinal cord injuries. So I do support passing this bill today, and just wanted to state for the record that that something that was in statute to be done was never done, and there may have been a disservice to some people who did encounter brain injury and were never counted into that system. And I hope that perhaps next year someone will bring forward a bill to address that issue.
Thank you. In my first term, I got a phone call and then a couple months later a follow-up phone call from an individual who was serving on this group and had all kinds of problems with it. And he called me a couple of days ago and said that what Senator Gaida has brought forth here wonderfully addresses all the concerns that he had as to why the group wasn't functioning as well as it could and so on and so forth. So that's just a little shout out to the bill. Anyone else? Representative Folsom.
I'm on that council and I never remember meeting with them and having a quorum.
So all to the good. Well, seeing nothing further, when the trainee clerk is ready. She may call the roll. And it is on Senate Bill 439. And it's relative to the Brain and Spinal Cord Injury Advisory Council and Community-Based Support Program. Moved or passed by Representative Folsom, seconded by Representative Knurk. Would the trainee clerk please call the roll?
Thank you, Mr. Chairman. Representative Leon?
Yes.
Representative McMahon? Yes. Representative Acton?
Yes.
Representative Gay?
Out of the room.
Representative Cushman?
Yes.
Representative Folsom?
Yes.
Representative Kelsey, yes. Representative King?
Yes.
Representative Kofalt?
Yes.
Representative DeLimis? Yes. Representative Weber? Representative McKay? Representative Snow?
Yes.
Representative Knurk?
Yes.
Representative Soloway? Representative Cannon?
Yes.
Representative Nutter Upham?
Yes.
Representative Shapiro? Representative Woods?
Yes.
And Representative Merchant?
Yes.
And Representative Pearson?
Yes. She wasn't doing it simultaneously with checking.
18. So 18 to 0.
I move that we
Consent?
put that on the
Consent.
consent calendar.
Okay.
The chair would be negligent if he didn't inform the trainee clerk that they don't all go this unanimously. And Representative Folsom will be happy to write the committee report. We still have a few minutes before the next bill will be heard, and so I'm going to pass some things out. This is another, please advise the chair. I'm passing this one out. I know you have another one, but this is an easy one as well. This is House Bill 1390. You will see on the left the House version with a typo, and the Senate voted right along with the typo, but made some changes too, and you will see them in the middle. And so you will see when they come, they're coming. I'll tell you again. Was that okay? Hi. Wow. Thank you. Yeah, we'll be with you guys in about 4 or 5 minutes. Yeah. That's us, Representative Knark. We're hard of hearing. You didn't hear me? That's the point. Oh, never mind. Sorry. Yeah, we're good.
Can you clarify? I'm just a little confused here in terms of what we're looking at in terms of how this is laid out. And that is the changes are highlighted in the gray?
Yep, should be.
Okay.
So, point of order, Mr. Chair.
Point of order.
Is this basically something that we sent over to the Senate? They modified it and sent it back to us. We're looking to concur.
Yep.
Yes, yes.
And they want my opinion on whether I agree, disagree, or disagree, and call for a committee of conference. And although I don't have to, I want to get your advice and guidance and thoughts and so on before I make my decision. Yes.
It was a typo.
If you look in the right-hand column, you will see the asterisk picks up and says it's a drafting error.
Oh, sorry.
All right.
Mr. Chair, given that there isn't a House session between now and next week, and given that there's a significant amount of change, and I, for one, am really tired.
Would you like to take this home and think about it on your own
Could we take
dime?
it home and look at it and
You
bring
can.
it back and think about it?
And also the big thick one called 503.
Yes, please.
If you want to do that, that is wonderful. There's no immediate urgency. All right.
Before we leave this, I am even more baffled than usual. If one looks at
State
the
your
RS,
bafflement.
yeah, if one looks at if we look in the first gray, it says amend RSA 310A. 310 as a title is about architects. So I'm a little bit baffled on why the architects are doing this, and I'm wondering if they have a drafting error. Yeah, this is the one where I picked up two different statutory reference errors, or one was where it should live. And by the way, I was privy to some of the stuff that was going on there. Insurance people had concerns about where we placed it. You may recall that there was a concern where it should reside in statute, whether it was DHHS or insurance. It got stuck into the 415. They didn't like that, so they're going to find a new home. But now it says 310, which is architects, which doesn't not make a lot of sense. That's one of the reasons I'm highly baffled.
Representative Leon is looking that up, maybe a few.
Well, I've looked up 310, but I'm going to go back to the bill and see if there's something wrong in what's written here.
It's in 310-A. So 310 is architects and 310-A is the Office of Professional Licensure and Certification.
Oh, thank you.
Because we like to make things very clear.
Wait a minute.
Take them home, look at them. Let me know what you think.
Will we have a discussion on it, or will it be, yes, and thank you for picking that up, or are we going to actually come back to this and do it together, or do you want us to individually just let you know what we think?
Sure.
That was a bit of a vague answer, sir.
You can, if it looks like I'm getting a good consensus coming in from
Got it.
everybody, then I won't
And-
need to
and-
do it in a group, but if.
Yeah. And
Otherwise,
thank you so
probably
much.
will.
It's that same thing as that F-F versus :F that I found in that 1347. It's like, duh. Thanks for picking that up.
And I looked it up because you brought it up. So
Yeah.
thank you.
Okay, I don't want to do this anymore. I want to do something else. All right, open the hearing on Senate Bill 279, establishing a study committee. On harm reduction and overdose prevention programs. Senator Waters, welcome.
Well, thank you so much, Mr. Chairman, members of the committee. For the record, I'm Senator David Waters from District 4, and I'm here to introduce Senate Bill 279. By brief way of background, I come to you also as a legislative member of the Governor's Commission on Alcohol and Other Drugs. And this bill is one that was worked on with the New Hampshire's Provider Association. You'll hear a representative of them testify later on. You know, New Hampshire has been much beleaguered by overdose deaths, but we've made a lot of progress as well. I mean, you on this committee know and are responsible for a lot of progress that we have made. I've seen it on the Governor's Commission. The recovery community, the recovery centers around the state have done really an extraordinary job. We've seen Governor Sununu's leadership with the Doorway program. So we put a lot of good pieces together. There are still a lot of overdose deaths in the state, as we know. And it does seem by people in this area that one thing perhaps we could do more on was harm reduction and overdose prevention programs. That is still something of a missing piece of the puzzle. You know, whether it's drug courts to the Doorways or other programs, we have found ways to help folks who are, you know, looking for treatment or in recovery. But if we want to prevent deaths, maybe this is something that we should look into. So what it proposes, as you'll see, a lot of findings, and it certainly recognizes the situation that we're in with overdose deaths in the state, and what harm reduction, overdose prevention programs are discussed here as well, that there are 165 of these overdose prevention programs operating in 10 countries, and looking for potential alternatives as well to the legal justice system being the kind of first stop for this issue as well. So what the bill intends to do is to have us take a look, to have us study for a few months and be able to make some recommendations for legislation. Now in the Senate, I will say that we've looked at this for the last couple of years, and we were in the middle of passing a bill a couple of years ago. COVID came along, some kind of further, you know, after strong support, unanimous vote in our Health and Human Service Committee, then decision to take another look at it, and so on. And in a way that couple of delays has been useful because programs have opened up. And I can just mention that if you do a search for the New York City program that's been open up and operating long enough to have some reporting on it and some statistics on it, you can search that. You'll find some extensive articles about it in the New York Times. Also, since we began talking about it, Rhode Island has passed a pilot program, and if you go to MedPage today, you can find reports on what Rhode Island is doing, and again, we'll be getting data from that. And Massachusetts and Philadelphia and some other places around the country are looking as well, plus all the foreign countries that have undertaken this. And there is, you know, one of the kind of larger peer-reviewed studies that looks at 22 programs that are reviewed. You'll find in the Journal of Preventive Medicine. So, you know, the internet's a wonderful thing, right? So you can go out there and look around and just see what the lay of the land is. And that's the kind of work that I hope this committee can do over the next few months. Take a look what's out there. Now we have some data about how they're done, and then see what might work for New Hampshire. And so that's what the study committees put together, and can make some recommendations to us. And I do hope that next year we will be ready to legislate in this area and see if New Hampshire is ready to have some overdose prevention, harm reduction programs enabled as an option for municipalities to take on. Thank you, Mr. Chairman. I'll be glad to take any questions.
It would seem that from the time it's likely to be signed into law until the report is due on November 1st, you might meet 2 or 3 times at most. So it's not a forever committee. It's go in, do your job, report, and that's it.
Thank you, Mr. Chairman. And I think that's just about right. As I said, we're now getting a lot of data, and I think that this will let people focus and concentrate on what we can think might work for New Hampshire.
Any questions for the Senator? Representative Shapiro.
Thank you, Mr. Chairman. Thank you for taking
Thank you, Mr. Chairman, and thank you for taking my question. It seems to me that this kind of issue, that people are very opinionated about this kind of issue, that people tend to have a fixed idea about whether providing a place for people to come and inject themselves with drugs is a good idea because it prevents overdoses, or it's encouraging drug use. So given the fact that, I am going to get to a question, given the fact that this is an issue that is likely to be contentious, and in my mind might be a very good idea, what is the distinction between having a study committee where a few legislators have experts come and testify before them and then write up a report? What is the difference between that activity and just proposing a bill where, once again, experts will come out of the woodwork to testify in front of a committee about a specific bill? Given the problem with recruiting people to do study committees, I'm trying to figure out what the real distinction is between those two things.
Well, thank you, Representative, for your question. And you really do get kind of the heart of the matter I think we face as legislators all the time. There are likely to be strong opinions once a bill emerges. And, you know, we're really pretty chary of establishing commissions, especially in the second year. And I will say, just to kind of back up a little bit, that I did try to put together a bill originally on this 3 years ago, or two years ago, excuse me. And it was based on our needle exchange bill, had all the same provisions of how you'd set it up, what the wraparounds would be in terms of medical personnel and approvals, and it was enabling, and so you'd have the law enforcement, neighbors, the municipality agree, and so on. That was kind of the model that was there, but the issue came up right away about, well, is this going to cause more crime, or is this going to enable more people to do drugs than otherwise would have, and would it help people actually get treatment or get healthy or, you know, get into recovery, so on. Good questions. I think what is useful about this is that we've got some data now, and I think that this study committee will be focusing very carefully on, okay, given that these issues are likely to come up, how do we write a bill? And I think a smaller group actually can do that more effectively. You know, once something is introduced, of course, then the fair is open, right? And what happens, happens. But I would hope that we'd be able to provide some very good answers and information through the study committee.
Senator, along the way, have you identified for me 3 representatives who are keenly interested in this, since I'm the one the Speaker's office often asks to go recruiting? Along the way, as you've studied this and talked it up and so on, do you have some people that I could call you and say, who would be good on this, and you'll give me the answer?
Yes.
Wonderful.
I will.
Thank you. Representative Weber.
Thank you, Mr. Chairman, and thank you so much for being here and for taking my question. I'm looking at line 27, and I was kind of hearing mixed messages. It says it is the intent of the legislature that OPPs should be evaluated in New Hampshire municipalities that authorize them. Are OPPs currently authorized at all in New Hampshire, and are there any operating here at all?
Well, thank you for the question, and I agree. Looking at the line, it does create that confusion, but the reason it's in there is that, let's say that a bill is introduced and it passes. This is a signal to this group that would work on this, the study committee, that you'd better have continuing studies in the legislation for those communities that may adopt this. So I think it's partly the verb tenses there, but no, there are not at this point in time in the state of New Hampshire.
Representative Merchant.
Thank you, Mr. Chairman. Thank you for taking my question, Senator. I served on the pharmacy board for 10 years, and part of that time was overseeing the prescription drug monitoring program, which also deals with the same basic issue. On that advisory council is currently a requirement for 2 House representatives and 1 senator. Is there any thought about utilizing that council instead of creating another commission? Is going to the council and having them help you guide through this process, because part of their requirements is to look at rulemaking as well as future legislation. So my question is, have any thought about, instead of creating another commission, another committee, is using what is already in existence, dealing with something comparable to the same subject matter?
Well, thanks for the question. I have two answers to that. I actually think that, given the function and purpose of that existing group, and thinking that this is going to be done by November 1st, 2022, that we might actually be able to get more attention through this vehicle. And then secondly, I think what's different here is that this is going to involve connections to a lot of groups that you may not deal with so much. The recovery community, recovery centers, police departments, other law enforcement, municipalities. So I think it's very, very focused, but also, might be a little more of a stretch for the group that you're referring to.
Follow up.
Thank you for that, Senator. When I looked at the composition of the advisory council, many of the people you're talking about are currently on that council. So all I'm trying to do is look at the legislative calendar and saying, can we use a vehicle that is up and running today and try to get this done sooner than later? I think the intent of what you're trying to accomplish, Senator, is great. I think it's something we have to do, because fundamentally what I've seen so far is that when we talked about reducing illicit use of prescription drugs, we never talked about the underlying problem, which is addiction. And what we've done is moved the addiction from a pharmacy to someplace else. We never dealt with the issue of addiction with it. And I think that would be a good tie-in between what's happening now is working with an existing group made up of physicians, police departments, the AG's office, and so forth, to probably try to spearhead your initiative sooner than later.
Well, I appreciate that interest. There's nothing, and I will say, Representative, there's nothing to prevent you from doing that anyways. I think that what is different here from the larger picture of addiction and recovery is that this is focusing on harm reduction and overdose prevention programming, which is a rather specific initiative that's being undertaken, and that's what I think this is about.
Representative Shapiro.
Yes, thank you, Mr. Chairman. And just to piggyback upon the previous question, this issue came up, I think, a year ago, and I'm serving on the Commission on the New Hampshire Drug Overdose Fatality Review Commission. And I thought that this was a perfect thing for them to study. So I brought it to that commission to say, is this something that we could study? And would you believe that they just felt like, even though it was so close to their mission, that they were just overwhelmed with setting up a fatality review commission, and were not able to take on another task like this. I don't know if that would apply to the other commission.
Thank you for your comment.
Representative Acton.
Thank you, Mr. Chair, and thank you, Senator. Just a quick point of information. I'm the sole state representative on the Opiate Abatement Advisory Commission. We got the bill this morning. I've largely stayed out of the money fight, but I am very much interested in this type of information. So would you believe, Senator, that if you do move forward in seating a committee, a study committee, I would like to volunteer for that? Or if there happens to be an ad hoc group over the summer to do studies, I can be available for that as well.
Okay, there's one.
Well, thank you, Representative. Would you believe? I'm delighted to hear that.
Thank you.
All right, Waters is 2. Yes, Representative Leon.
Thank you, Mr. Chairman, and thank you, Senator, for being here with this bill. I'm not sure if you also read a relatively troubling investigatory story from NHPR about some issues around some of the recovery houses. I'm just hopeful that anything that's going forward with these OPPs, where people will be in vulnerable situations, that any potential for misuse of trust will also be addressed. So would that be true?
Thank you, Representative. And, I appreciate that story. It's a tough story. I've worked very closely with a lot of the recovery centers in the state, and I know it's of great concern And I think any legislation that comes forward is certainly going to have to make sure that we do it right. Mm.
Representative Weber.
Thank you, Mr. Chairman. And because the chairman had this question with respect to another bill, I'm looking at the drafting, and although it's a Senate committee, I noticed that the House members are put on first and a member of the Senate is put on after. Traditionally, Senate committees have been convened by senators, and they're usually named first, and Senate committees are generally staffed by Senate staffers. So I just want some assurances, because we have had problems in the past with House members being told that they're going to staff Senate-created committees. And I just want to be sure that this is a Senate committee with a Senate convener and Senate staffing, because our staff is very small relative to the number of people they serve.
Well, indeed, it is a Senate committee, and that would be my, thank you, Representative, that would be my assumption. But if you'd like to make that assumption even clearer, you could say that, you could add that the first meeting was called by a member of the Senate. Yeah, and that would make sure.
Yeah. The backstory to this is I had to spend several months working with a commissioner because it was a wonderful bill signed into law, but who is bold enough to call the first meeting? It wasn't in the bill. So I got appointed not as a representative, but as a citizen, and we all looked in different directions and whistled Dixie, and we got it going. But so I'm keen on seeing those things.
And thank you. And, you know, I think that they owe us just a boilerplate for study committees, but I think it would be good to specify that the senator calls the first
Or you
meeting.
could just do it, and Representative Act and two others will just show up.
Study club.
Point of order, sir, but line 17 already says the Senate member calls the first meeting.
Oh, I missed it.
It's
All right,
it's already in
so
the
what do
bill.
you
I know
know?
I'm not supposed to speak because I'm
We
a
got it
co-sponsor,
already?
but it's already there. Yeah, line
Well,
17
gee.
already states this.
I did too,
Me too.
and I'm usually keen
It's
on
that time of day. The eyes are glazing.
Well, I didn't see it last night either. Okay, anybody else with a question for Senator Waters? Representative Snow. Mike. This is a good time for
Here it is.
live mic.
Once again,
What do you need?
Mr. Microphone fouls it up again. A few years ago, I was placed on a study committee like this, Senator and three of us, when Narcan first came out.
Oh, yeah.
And of course, the speculation then was this is just going to increase drug abuse because all these people that are abusing drugs are going to walk around with Narcan in their pocket and feel like they can do it. And interesting, the thing that we discovered as we explored, where we brought in several people who are regular users, and their answer almost unanimously was, I thought I had that under control. I'd never think of bringing that Narcan in. That was never anything that ever crossed my mind. And I think this, and even the ambulance drivers who responded and are often the ones that administered it.
Wandering our way
acknowledge the
to a
same
question
thing.
mark.
Yes,
yeah.
I said, would you believe
Would
that-
you? I didn't hear you. I
Yes, I did. I said, "Would you
apologize.
believe
Well,
it?"
that's
But I think, and he's shaking his head in such a way that I think he does. And I rest my case.
Thank you, Representative.
Seeing no further questions, thank you,
so much.
Senator. And the chair recognizes Ryan Fowler from the New Hampshire Providers Association, and you can tell us what that is.
Pardon?
What is the New Hampshire Providers Association?
So the New Hampshire Providers Association is a membership organization of substance use disorder providers in treatment, prevention, and recovery.
Okay.
So across the continuum, we represent substance use professionals.
Oh, look at that. It's right there in the masthead of your stationery.
Indeed
Good.
it is.
Thank you.
Thank you, Chairman, and thank you to the committee for hearing me. There is a letter going around from NHPA. As you've heard, I'm Ryan Fowler. I'm the harm reduction coordinator for a small aid service organization in Lebanon, New Hampshire. I work as the harm reduction coordinator in the Upper Valley of New Hampshire and Vermont. Primarily, my full-time gig is operating a certain services program that was made legal by Senate Bill 234 a few years ago. I'm also the policy chair for New Hampshire Providers Association. I sit on the governor's opioid task force. I work with the New Hampshire Training Institute for Addiction Professionals in Attica. I work for JSI as a consultant and advisor. And I'm here today in support of Senate Bill 279 as kind of a pragmatic approach forward with harm reduction in New Hampshire. I'm somebody who's alive because of harm reduction. I'm a former injection drug user, and I've been saved 3 times by Narcan. I was provided syringes illegally through my chaotic drug use that ended in 2014. And I come from a social circle of people who are here because of harm reduction. You know, harm reduction is as a strategy is really a way to keep people alive, because dead people don't enter recovery. And really, recovery is a natural thing when human needs are met. And for me, the goal of a harm reduction program is to meet human needs and understand that people are using drugs for no reason. Like, any human behavior serves a purpose, including chaotic drug use. And what I see working primarily in the Claremont and Lebanon region of New Hampshire and on the other side of the river in Vermont is that people are meeting their human needs by using drugs in a chaotic way. And once we meet them where they're at and empower them and support them, recovery is natural. And I see far more recovery-oriented pathways than I do chaos. I see a lot more success stories than I hear death stories, because harm reduction works. And what we know is, you know, syringe programs like the ones that I'm able to operate in my region of New Hampshire, they're possibly the most studied public health intervention. There's 30+ years of research that show that they're a good idea, but there's a lot of gaps in New Hampshire. There's currently no syringe access in Laconia or the North Country, and there is a significant cost savings and return on investment when we look at harm reduction as a way to prevent healthcare costs, death, disease transmission. And it's just really, really unfortunate when people's needs aren't met, what happens to that chaotic drug use that we see on the headlines time and time again. And you know, as we look at this as a public health issue, we realize that, you know, prohibition and the war on drugs doesn't work. Really, law enforcement have no business dealing with a nonviolent health issue. So what are we going to do when we address this as a public health issue? Harm reduction is a way to keep people alive and keep people safe and save money. And I think that overdose prevention programs like the one in the title of this bill are a great idea, but there's an order of operations, because harm reduction strategies are on a continuum. We heard about Narcan or naloxone. We've heard about syringe programs. There are gaps in New Hampshire that I think that we're going to find, and if we invest money in a way that supports people and doesn't criminalize them or punish them, then the cost savings are really tremendous, and it really improves the quality of life for everybody in the community. What we see when we empower people and meet their human needs is that people get better and they stop doing crime. Think of this as pre-recovery engagement, and really, it seems counterintuitive. I know it really does seem counterintuitive, because we only know punitive responses in the war on drugs. We have to punish them, but it doesn't work. It actually makes the problem a lot worse. You know, we really need to see something better. We all need to do something better about the drug problem, because putting people in a cage for a health issue isn't an effective strategy for reducing trauma-related drug use. It's really a system built on trauma, and it's really, that's my spiel. You know, I really believe in this stuff. I've dedicated a lot of my life to it because it works, and it's awesome to see. But is it working in New Hampshire? You know, there's currently several programs, mostly on the southern side of the state. You know, where is it that we can do better? And I think that if we're going to do anything to address this problem, harm reduction is the way to go. And my hope is that a study committee will demonstrate that and allocate funds accordingly.
Thank you very much. Representative Weber with a question.
I just note that your letter here says you're attaching a 3-page fact sheet, and I didn't see that. So I wondered if you would be willing, if there is such a fact sheet, to just email it to members of the committee so that we could take a look at it.
Absolutely.
Thank you.
I know that it was emailed to Senator Waters, so I can certainly make sure it's forwarded to the committee.
Perfect. Thank you.
Representative Nadarapam.
I wondered if you could supply your contact information, because I have like a ton of questions that I won't take up the committees with time today.
Absolutely.
Okay, thank you.
And any other questions? Seeing none, thank you so much.
Thank you so much.
Welcome back, the Honorable Joe Hannon. I tell you, they always come back to us.
Thank you, Mr. Chairman. I almost expected to hear music after you said that. So,
You didn't hear
thank
the
you.
music?
Never mind. My name is Joe Hannon, and I'm in support of this bill. Little background: I am a person in long-term recovery, over 30 years myself. As a representative, I was a co-sponsor of the naloxone, the Narcan bill. I had a lot of experience getting that through the legislature, which I can tell you, as you know, was not easy because of some of the rumors and misconceptions out there. I put in the first syringe exchange legislation when I was in office, and then when I was out of office, I had our good senator here and another senator be the prime sponsors for a new bill, which became law, and now we have syringe service programs throughout most of the state. As Ryan Fowler said, not enough of it, but we've increased at a very significant rate. One thing that we know, and you've heard this before, there is over 30 years of data that supports syringe service programs and the effect they've had. Naloxone is a life-saving drug that is absolutely vital and is the only thing that can actually stop someone from overdosing when they are overdosing from an opioid. We've heard one person already here today say that they've been revived 3 times. One of the negative things you usually hear is people say, oh, this person was Narcan 15 times, and, why are we doing it again? People like the person behind me and other people I know, friends of mine, are here today because we didn't give up on someone. When pushing for the syringe exchange legislation, I talked to everybody. If anyone was here when I did that, you probably were sick of seeing me. But I can tell you that he's not, thank you. I didn't start the conversation with people who weren't familiar with what syringe exchanges and other harm reduction programs did by saying, well, look, we're going to help people who use drugs to do it safely. They're looking at me like I'm crazy. But if I said, look, we've got this great program that is proven to save lives and prevent infections, HIV, hepatitis C, prevent the negative consequences of all those actions, and also as a way to get people to have greater access to recovery services and to help that they need, other medical services that they need and don't usually have that gateway to because they're afraid to go to hospitals because of the way they're treated. They are usually, though we do have some programs in the penal system in the state, they are not enough, and they don't generally get all the people that we need to have treated. Many people are in jail because of substance use and other mental health issues, and it's not the priority of the penal system to get people physically better into recovery. Even though we have to provide treatment by law, that's not generally what happens. I don't want to get too grandiose here, but I heard one person say, do we have any opioid prevention programs in New Hampshire? And the answer is obviously no. There are very few in the United States. One recently opened up in New York City. We've got over 160 some programs around the world, and they all have one thing in common. No one has ever died of an overdose in any of those facilities. We've had over 100,000 people overdose in the United States in the last year, and around 2/3 of those died from an opioid overdose. That number's not going down. Any law we put in to increase penalties and arrest people and try to take the drugs off the street is not working. Drugs are stronger, cheaper, and more potent, and more people are dying. If we went to the state stores and tried to buy a 6-pack of beer, and one out of those 6 beers was a different concentration, the beer could probably kill you, we'd all be kind of nervous. But back to the question, do we have opioid overdose prevention centers in New Hampshire? Sort of. We have bars. You go to a bar, the bartender cuts you off if you look like you're getting too inebriated. Someone might call you a ride. There's someone watching you. Most people that overdose in the presence of someone else. Most people that are found dead from an overdose are found alone. And that's why we passed the Good Samaritan law, which allows people to call during an overdose, and that does prevent that. We don't have hard data on it because we are a small state, but we do know that that is one thing that gets people to get the help that they need. I heard many stories from paramedics that I know personally, and my wife has worked with as a doctor, that people would be found in the shower when they get called for an overdose because they thought maybe the cold water wake them up, and they find out how long they've been there, 20 minutes. They might already be dead by then or have brain damage. Places where someone can go and get the supervision they need can save their lives. And the last thing I'll say is, on the way over thinking about this, I was thinking about the parable of the Good Samaritan. Don't worry, this isn't a religious lecture. Just the first person that came upon him just walked past. The second person, same thing. The third person actually helped bandage the wounds and take care of that person. I think we're all called to be that Good Samaritan. And this is a great first step to starting that process and to do it right by not just leaving it to all the people that are studying it. I'm on the opioid task force and lots of other meeting groups and commissions. People are looking at this, but we need legislators to look at it to start the process of getting you and everyone in this building and across the street to start seriously contemplating how it's going to work. We know it works. We have to start thinking about how we're going to do it. And I think this is the best first step to start. And be happy to take any questions, and thank you for your time.
Thank you, Representative. Any questions? Representative Soloway.
Thank you, Mr. Chairman. Thank you, Representative. I haven't seen you in a while. It's been at least 48 hours.
I know.
Can you describe any programs that may exist or have existed in the Dover and Rochester area that have been effective?
Funny you should mention that. Yeah, not just. We didn't talk about this at breakfast the other day. We have syringe service programs in Rochester, Dover, Somersworth. There are programs now in Concord that has been started in the last year. We have a syringe service program in Manchester. They're also in the southern part of the state and west part of the state, Claremont. We don't have a lot in Laconia in the North Country, like you heard, but there are programs. In Manchester, when we started doing the syringe service program there, I think the first big month that we started in April or March, I forget the exact month, but a year later in May, we gave out 500 kits of naloxone to people on the street. And many of them had we ask people, we find out how many syringes they give us, how many we get back, we write it all down, how many referrals we make. And another thing we ask people is, have you reversed any overdoses since the last time you were here? In the first year and a half that program was in Manchester, our participants reported over 3,000 overdoses were reversed. That was more than all the hospitals and paramedics in the city combined. Not putting them down at all, they do a great job. But one thing we've seen in the data from the state is people, even when paramedics are responding to an overdose, it is becoming increasingly more common for them to show up and someone has already received Narcan and is maybe already breathing. That is key. So it's not just a matter of making a phone call and sending someone out to save a life. We can have a program where someone can be there and it's almost instantaneous. This is basically making our job easier. Most people that are using drugs chaotically, illicit substances on the street, are doing so secretively. They're trying to hide. They don't want to get caught. They're doing it as quickly as they can in a place that may not be, it may be in public. It may be, and it can create a public health risk when people are doing that. Not that they're leaving syringes around more often. They're actually less likely to leave them around because of syringe programs. But when someone is rushing, and if someone is not doing it in a clean, sanitary manner, they're more likely to get infections. They're more likely to overdose and die because they're doing it very quickly. When we teach people we give out syringes to people that are using IV substances, we teach them how to inject properly. And again, some people might think, oh, you're encouraging drug use, you're enabling it. We're only enabling people to not die and not get sick or injured. That's it. They're doing it anyway. They were doing it before we came along, and they're probably going to do it if all these programs go away. But the sicknesses will still be there in higher numbers. The overdose numbers that we've seen in this state, I can't remember the exact number, but I think it was 2 years ago or a year and a half ago, the beginning of COVID. Overdose rates around the country had increased drastically in just about every state. There were only, I think, 2 states that they decreased in. New Hampshire was one of them. And that was the year that we had a vast amount of syringe service programs flooding the areas with naloxone to not just everybody, but the end user, the person who was more likely to be around someone that was going to see someone overdosing. And
Representative, thank you so much.
Sorry.
I
Yeah, I
want to
can
see
keep
if
going.
there's some other,
Yeah, please.
because the title of the bill is, do we establish a study committee?
I thought we were studying it now. No, I'm kidding.
We haven't exec the bill yet.
All right, I'll wait.
All right. I really have missed you. You know that. Come back again.
I
Don't be
appreciate
strange. Any other questions?
That's a good idea. Okay.
Thank you for coming.
Thank you very much.
This concludes the hearing on Senate Bill 279. Wonder if we're ready to go to an exec session, or do you want to ponder it for? Thank you. Ponder it for a while. What's your pleasure? I'm sorry?
Getting thumbs up.
Okay, thumbs up. We're ready to rock and roll here. Okay. Open the exec session now on Senate Bill 279. The chair will entertain a motion. Representative Netta Upham.
Again, I move we ought to pass.
OTP. And who is that?
Dr. Soloway.
Dr. Soloway, I presume. Okay. I know. Any discussion? Doesn't have to be a question now. This is execing. Representative Merchant.
Thank you. Like yourself, I think we have a lot of study committees and commissions and so forth, and we have a hard time to fill them. However, given the gravity of the situation, I think we need to find a solution because I mentioned before, on the prescription drug monitoring program, we've done a phenomenal job in reducing the number of illicit prescriptions or prescription drugs being used illicitly. Unfortunately, did not tackle the underlying problem, which is addiction. And I think we need to find some way to start looking at that seriously and find some solutions to it.
To me, the idea, well, there's two things. The idea that once this is signed into law, it's got to do a lot of work and be done by November 1st, sounds to me like it's just a prep group for bill writing. And number two, since the senator has promised me he will get the people to fill the slots, I'm very happy. So just a couple of reasons.
One of the things I'll talk to the senator afterwards is there on the advisory council there's currently 2 reps and 1 senator. So, I mean, he could probably call upon them as well and have some cross-pollination between the 2.
Sounds like a plan. Anyone else? Share? Ask? All right. Which one of your group is go? Oh, wow. Okay. The motion before us, it's on Senate Bill 279, which, well, you just heard it. Establishing a study committee on harm reduction and overdose prevention programs. The motion is ought to pass, made by Representative Nutter Upham and seconded by Representative Soloway. Would the clerk please call the roll?
Representative Leon,
Yes.
Representative McMahon,
Yes.
Representative Acton,
Yes.
Representative Gay, Representative Cushman,
No.
Representative Folsom,
Yes.
Representative Kelsey, yes. Representative King,
Yes.
Representative Kofalt,
Yes.
Representative Delamus, sorry. Representative Weber, Representative McKay,
Yes.
Representative Snow,
Yes.
Representative Knurk,
Yes.
Representative Soloway,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson, sorry.
Yes.
Okay.
19 to 1.
19 to 1.
And the committee report to be written by Representative Nutter Upham.
Sure.
Of course.
Can I move to put it on consent if
You may
there's
ask
no objection?
without objection. No objection?
No objection.
All righty, on consent. This concludes the exec session on 279, and it looks like the amendment that we spoke of this morning is back. So, Representative Merchant? Well, he'll tell us. 279, you say? 289. Yeah, 279 we just did.
You want to speak to it? Sorry. We're also looking for an amendment on 289. This is 229. Sorry. I pinged OLS once more, but the one that was more complicated came back sooner than the one that was. Thank you. That was the one in which we had a change because of drafting error in the first paragraph. And the other one was at the same time was take the amendment that I created with Representative Guthrie to add it to the same amendment, so you have one amendment. So you should have before you, I want to say thank you. Oh, sorry. No, sorry. Time to go home.
Senate Bill 229, the
Yes.
chair asks Representative Merchant please to continue, sir.
Thank you, sir. I want to say thank you to Representative Cushman to working with me on this over lunch. And we put our heads together, and I think we came up with something we all can we at least agree with, and hopefully folks will agree with us as well. So I gave out two pieces of paper. One's the amendment, the other one was in 318-16F, because that's the part that's getting repealed. And some of the concerns that were shared were dealing with what was in 16F, because being repealed, we lose it. And in talking with Representative Cushman, I recognized that some of the things that she's referring to in the statute were actually addressed in the rules, but she felt more comfortable and okay with it, putting it in the statute. So what we did basically... Oh, yeah. Should be a ton of them.
I know. Did they get caught somewhere?
I have just one.
I have one.
You have a bunch of them?
Yep. So you should be looking in front of you to Amendment 2022-1334H. And also you have another piece of paper which is circulating, which was Section 318-16F, which is the statute itself dealing with what's being repealed. And the reason I'm sharing this with you is understanding what, do you have them both? Which one?
I do.
So does everyone have RSA 318-16F and Amendment 2022-1334H? Okay. So in talking with Representative Cushman over lunch, the concern she had was the fact that many things that are in the RSA were actually in rules by the Board of Pharmacy at the time we created the rules. We recognize that one of the things critical here is having whoever's going to do the vaccines is being trained in CPR, cardiopulmonary resuscitation, which is critical. It's in rules, but it wasn't in statute. So basically what we did, if you look at RSA 318-16F and look at number 6, certified pharmacy technician has a current certification of basic cardiopulmonary resuscitation. We moved it from this section back into the amendment so it stays consistent. Nice thing about it is because it's in the statute now, all the pharmacists as well as the licensed technician and the certified tech all have to be CPR trained.
And we want that anyway.
No?
We do.
Oh, you do want it? Okay. I wanted it, but
I do.
Then we talked about in line 17, there was no reference back to the statute dealing with a certified registered technician. So to be consistent, we wanted to anchor it down in that RSA, which is RSA 318-15A, which is my initial amendment. It's sort of implied, but we want to be sure it's explicit. If you look at line 22 through 24, is that the training has to include hands-on. It can't be something you take online. It's pretty hard to understand how to give an injection online. So you want to be clear that it has to have in-person training. We also want to be sure that if you look at number 4, which is line 25, about certification in cardiopulmonary resuscitation, because we added number 4, we had to modify line 26 to include lines 1 through 4. And the other requirement was the fact, which again is pretty self-explanatory, is that before you give a vaccine, you should at least review the vaccine registry. It's pretty much implied, but we wanted to make it explicit, so we did. I want to say thank you to Representative Cushman for helping me along the way.
And thank you very much for working with me.
Representative Merchant, would you make a motion on the amendment?
I'll make a motion on the amendment to pass Amendment 2022-1334H.
And Representative Cushman?
I will second.
Thank you. Any further discussion? We have before us the amendment 2022-1334. Motion is ought to pass. Made by Representative Merchant, moved by Representative Merchant, and seconded by Representative Cushman. And would the clerk please call the roll?
Representative Leon,
Yes.
Representative McMahon, Representative Acton,
Yes.
Representative Gay, Representative, not here, okay, Representative Cushman,
Yes.
Representative Folsom, Representative Kelsey, yes. Representative King,
Yes.
Representative Kofalt, not here. Representative Lamus, Representative Weber, Representative McKay, Representative Snow, Representative Knurk,
Yes.
Representative Soloway, absent then, okay. Representative Cannon, Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
and Representative Pearson.
Yes.
Sorry again. So that is
Rookies.
19 to 2. Well, 2 not voting. No, 3 not voting. 18. Sorry.
18.
Yep, you're right.
18 to 0.
Zero, yep.
To 0.
3 non-voting. Now, who would like to make the motion for the bill as amended? I was going to put you down anyway. Representative Cushman, what is your motion?
Thank you, Mr. Chairman. I move that we pass the House Bill 229 as amended by Amendment 2022-1334H.
Your motion is ought to pass as amended.
I will
made
second
by
that.
Representative Cushman and seconded by Representative Merchant. Any further discussion? Then would the clerk please call the roll?
Representative Leon,
Yes.
Representative McMahon, Representative Acton, Representative Gay is not voting. Representative Cushman,
Yes.
Representative Folsom, Representative Kelsey, yes. Representative King,
Yes.
Representative Kofalt, not voting. Representative DeLemus, Representative Weber, Representative McKay, Representative Snow, Representative Knurk,
Yes.
Representative Soloway, Representative Cannon, Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson.
Yes.
All right, we have 19.
That's
19 to 0, sorry.
consent. And Representative Cushman, if you would write the committee report, please. And if we can hang on about 3 or 4 minutes, we've got the other amendment being run up from downstairs.
Does she have it upstairs? Or
She's making copies
copies for us?
presently.
Okay, thank you.
think so.
289.
I think it's 289, yeah. Well, it's right at number 414. There it is, right there. There's Canuck. I seconded it.
One for Plan Administration 328. Yes, it is.
Yeah. Well, that's right. Ah.
That's a paper.
Thanks. I think this was an extra set for me because I had, I brought them all because I printed them out at home last week and I was ready to rock and roll here. Opened. What was that about, my dear brother? I would be honored to be in the same paragraph as my friend. Open the, I don't know what, executive session on the amendment to SB 289. The chair rules it germane. And Representative Merchant, would you speak to the amendment, how it fulfills what we wanted?
Thank you, Mr. Chairman, and fellow members of the committee. You should be looking at Amendment 2022-1336H. And the amendment is to Senate Bill 289, which was the glucagon administration. And thank you, Representative Canuck, for catching the typo. In line 8, it now agrees with line 9. Its amendment should be 2022-1336. Are we all set? Oh, thank you, Representative Snow. So basically, Representative Canuck caught a drafting error, which was in line 8. We fixed that, so line 8 now agrees with line 9. And we also then took the amendment, which I drafted earlier, to then include that language into this amendment as well, which is basically taking the format of the prescription, which is line 13, and moving it from what was attached before in 318B over to where it belongs now, which is 126A 91. It's a simple bill.
We will keep it called such. And so are you moving this amendment?
I will make a motion to move the amendment.
And the chair seconds it. Any further discussion on this wonderful little bit of simple? Seeing none, hearing none. When you are ready, Rookie Clerk, call the roll. On 2022-1336, the amendment. Motion is ought to pass, moved by Representative Merchant and seconded by the chair. You may call the roll.
Representative Leon.
Yes.
Representative McMahon.
Yes.
Representative Acton.
Yes.
Representative Gay. Voting. Representative Cushman.
Yes.
Representative Folsom.
Yes.
Representative Kelsey, yes. Representative King.
Yes.
Representative Kofalt. Not here, absent. Representative Lamus. Representative Weber, absent. Representative McKay. Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway. Representative Cannon.
Yes.
Representative Nutter Upham. Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
So we have, Representative Pearson.
Yes.
You're holding on to that rookie status.
18-0.
It's always fun when other people realize that calling that crazy list is probably the hardest part of the job.
Representative Merchant, I call on you for another motion.
I'll make a motion to pass Senate Bill 289 ought to pass with amendment.
And the chair seconds it. And since the amendment we just unanimously voted replaces the bill, I trust there's no further discussion. Thank you.
Yeah.
That's not past our ability. The motion before us is House Bill 289, Senate Bill 289, as amended by Amendment 2022-1336. Motion ought to pass as amended, made by Representative Merchant, seconded by the chair. Would the trainee clerk please call the roll?
Thank you. Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton. Yes. Representative Gay, absent. Representative Cushman.
Yes.
Representative Folsom.
Yes.
Representative Kelsey, yes. Representative King. Yes. Representative Kofalt, absent. Representative DeLamus. Yes. Representative Weber, absent. Representative McKay. Yes. Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway. Yes. Representative Cannon.
Yes.
Representative Nutter Upham. Yes. Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
18-0.
18-0. What do we remind the chair of? Consent. And Representative Merchant to write the committee report. And this concludes the exec session on Senate Bill 289. And folks, we got a lot of work done today. It went well. I think everybody had a chance to speak when you needed to. Want to thank Christina Dias so much. Thank you for all of this, making it possible today. And because you did such a good job, we hope to see you again next Tuesday. 9:30. Remember, it is the revised schedule for next Tuesday. You'll be seeing that in the House calendar coming out in a few days. We will be looking at 4 late from the Senate, but early we must act bills, and there are going to be some differences of opinion. Ms. Dyer, are there copies available for next Tuesday's bill? And they were all in the packet today. So we're finished. Thank you, everybody. Good job, all.